that it's relevant to have the support that is of short and medium term, a support that involves questions such as hygiene, security, and support for the preparation of a recovery, including physical health, mental health, and volunteers. Finally, the participation was put as essential for it to be important to have committees with participation of government, civil society, private sector, academia, and subnational governments that can define criteria and priorities. A criteria example that is intersectional would be to give additional points to projects suggested by women or with stronger women, black women, indigenous women in the administration of these projects, or when it involves marginalized communities such as rural youth. We cannot forget it's crucial that all types of financing have transparency and indicators connected to gender, race, and other inequalities. That was a summary for those who were unable to be with us yesterday. And now we head on to another productive day, where at the end of the day we will also, don't forget, we will actually have a conversation, a session about the document that intends to summarize and take the main recommendations out of what was said here for us to discuss and use it later during our discussions and activities of political incidents. Thank you very much and have a great day. Great, thank you Alice for this recap. And on our third day, our focus changing to look at engagements guided towards action and critical data questions. We're going to explore. The session will examine how economic needs and climate crisis intersect to accelerate population distribution, urbanization. It will focus on the heightened vulnerability of population urban informal settlements, called Emerging Vulnerability of Urbanization Risk Reduction. This ninth session, while populations concentrate themselves more in urban centers, they become more significant for the climate, and they are disproportionately affected by their impact. This session is going to examine how economic needs and the climate crisis intersect to accelerate population distribution and urbanization. It will focus on the heightened vulnerabilities of populations in urban and informal settlements to extreme weather events and the urgent need for sustainable urban food systems. I will present our moderator, Madam Michele Melchiorri, official of the projects of the Unit of Risks and Disasters of the Common Center of Research of the European Commission. Michele, the floor is yours.
Welcome to this session, Emerging Vulnerability.
Essa sessão, a vulnerabilidade emergente da urbanização e redução de risco das abordagens. Essa sessão é coordenizada pela UNFPA e o Centro da Comunicação.
From the recognition that urbanization is a global megatrend, with more than half of the world population living in urban areas, and with this proportion expected to increase, adding millions of urban inhabitants very soon. The complex relationship between urbanization and climate change presents one of the most pressing challenges of our time. As global population increasingly concentrate in urban centers, as we heard, these areas become both significant contributors to and affected by the impacts of climate change. Crucially, these impacts, and I underline that, are not felt equally by everyone or everywhere in the same magnitude or frequency. Given the escalating risk and inherent inequalities, it is vital to measure urbanization vulnerability in the context of climate change by promoting the development of information systems that are open and free and accessible to all. Such measurements allow for a systematic understanding of which populations are exposed to which hazards, whom and which areas are most at risk, what specific hazards they face, and how often, what capacity to adapt and mitigate exists or have to be put in place. Data is essential for informing targeted policy interventions, resource allocation, and the development of effective adaptation and resilience strategies. Evidence-based policy is key for resilient cities and human settlements and for the post-2030 development agenda at large. That's why UNFPA and the JRC conduct joint work on the improvement of population and human settlements data in the framework of the degree of urbanization. The degree of urbanization here, a new brochure produced by UNFPA, is a methodology to improve urban and rural statistics by adopting a harmonized people-based approach to define urban and rural areas for international statistical comparison. We will see during the session how this methodology can be applied to census data. We will have a concrete case to address climate change analysis. This session will explore data, approaches, and challenges to harmonize information on human settlements and the relationship between urbanization and risk reduction, and how, most importantly, how information collectively produced can help policymakers and make impact in communities. We will have two presentations followed by a panel discussion with panelists joining us online. So to start, I would like to invite Dr. Johannes Hull to deliver his presentation on the JRC Global Human Settlement Layer, a baseline dataset for vulnerability, exposure, and risk assessment across time and spatial scales. Let me introduce Johannes first. Johannes works as Scientific Project Officer at the European Commission Joint Research Center in Italy in the Global Human Settlement Layer project, where he focuses on settlements, built environment, and data production, integration, and validation. Johannes, you have 15 minutes.
So, good morning, everyone. Bom dia a todo mundo. Thank you, Michele, for the introductory words. So, yeah, let's get started with the introduction of this data set that we are working on, which is the Global Human Settlement Layer. The next slide, please. So I'd like to start off with this kind of visualization of the complex system of climate change and urbanization and their interactions. It's a very simplified and incomplete view, but just to illustrate this a little bit, so we know all about the drivers and causes of climate change. We know about the effects of climate change, extreme weather events, droughts, etc. We know that these events and conditions cause migration. We know that this migration is partially a reason for urbanization. There are other drivers and factors of urbanization. We also know that urbanization and the focus on urban areas also causes left behind rural populations. Now, urbanization can play out as rapid, uncontrolled urban growth, right? And in such a case, we speak of unsustainable urban development that fuels inequalities from which urban populations suffer. At the same time, we have hazards caused by the effects of climate change, extreme weather and climate events. These hazards cause risk to which urban populations are exposed. And if the development is unsustainable, this also enhances or increases the vulnerability of urban populations. And finally, unsustainable urban development again causes carbon dioxide emissions. So we have this kind of circular effect in this system that we're seeing here. And now if policymakers need to intervene and take measures to mitigate the problems in this system, then they need data, right? They need data that are crucial to measure, understand, and mitigate these complex interactions. Data are key for decision making, to monitor progress of implemented policies, and also for risk reduction. Detailed and accurate data on the built environment, urban growth, and population dynamics are essential baseline data. So it's not only data about population itself, but also where they live, where they shelter, what are the conditions of the buildings they live in. That also are a contributor or a driver of their vulnerability. So the global human settlement layer is a multivariate data source for characterizing buildings and their inhabitants, and I'd like to introduce this data set a little bit. So here you see one of the components of this data set, which is GHS POP, so it's a global gridded population data set that you can see here that counts resident population at fine spatial grid cells for each 100 by 100 meter cell globally. GHSL is a product that integrates remote sensing data, so satellite-derived observations from satellite imagery and population census data. It's all free and open data, available from 1975 to 2030, so the data also includes a short-term projection into the near future. And let's take a closer look at this data set. So here we're zooming into Manaus in Amazonia in Brazil, where you can see the colors representing population density. So higher colors, higher population density, and you can nicely see how the city is located in their geographic context, obviously dominated by water, by the Amazon River. These data allow for regional multivariate change analysis. I'm showing here a map of a region that we've seen, I think, the day before yesterday in one of the presentations. So we're looking at Cairo and the Nile Delta here. And what you can see are basically two layers of this data set. One of them is the GHS built that measures built-up surface over time. And the second one that you can see here, so this is the built-up surface, right? And the second one is the degree of urbanization, which is a global and harmonized definition of the rural-urban continuum. What you can see to the right in this graph is then already a result of combining these data. These data allow, for example, to measure the evolution of urban population versus the evolution or change in urban built-up areas. And what you can see here, has been a disproportional growth of urban population with respect to the area in which these urban populations live in. This is a second visualization that shows how this data can be used to visualize and compare the urban growth that cities have experienced in the last 50 years. We're looking here at 91 cities at the same time. They are arranged in a so-called quasi-geographic space. So you have the Americas to the left and Europe, Africa in the center, and then Asia to the right. So it is kind of oriented like the commonly used world maps. So you can see the more red color you see, the more urban growth has happened, and you can see where, in which world regions this has occurred. You can see clearly the China and Asia sticking out, but also cities in Africa and some in the Americas. If we look at individual cities, we see here again the example of Manaus. So we see how built-up areas have changed over time, how population has grown over time, and how this classification of the degree of urbanization, which is a model of the rural-urban continuum, has changed. So you can see the kind of limits of the city moving outwards due to urban sprawl and growth. We can even take a closer look and also look at some other attributes that are quite important when it comes to vulnerability. This is a data set that is called GHS-H that aims to measure the predominant construction epoch of buildings within each 100 by 100 meter plot or grid cell. And I'm showing here two cities. One of them is Kathmandu, Nepal, to the right, and the other one is Brasilia, where we are right now. From these maps, you can see on the one hand the different urban development phases. You can also see the shape in which cities have grown. You see Kathmandu has experienced a rather concentric growth, whereas the pattern here in Brasilia is more complex, as it is a planned city. What is interesting, for example, to point out is in the very west of the map, you can see Sol Nascente, which is one of the largest informal settlements in Brazil, and how it has grown over the last decades. We can take even a closer look at where populations live, really measuring the texture of cities. So here you can see the patterns of different cities around the globe, and such data are useful to also look at, building density and also the characteristics of informal settlements, for example. And at the very finest spatial grain, these data allow to enrich global building microdata. This is a data product called GHS-OBAT, Open Building Attributes. And here you can see building age really mapped at the individual building level. We're comparing two cities here. One of them is in Brazil, is Nova Friburgo in the state of Rio de Janeiro, that suffered from a landslide disaster a few years ago. So you can use this data to monitor where people build and if people are building into areas of higher risk, for example. And on the other side, of the right, we see the town called Iperu in Nigeria, where you can again see a very concentric growth of the city or of the town. So this summarizes a little bit this data set. So it's a multi-scale integrative framework that produces global data that is then disaggregated or reaggregated at different analytical units. For example, there is the urban center database that produces statistics for over 11,000 cities worldwide. I think we will hear more about that in a later presentation. That is already integrated with other data sets. And such data can be useful, of course, for further integration. We've heard yesterday in one of the panels, integration is key, so we can integrate this data with other data sets and conduct joint analyses. And I'd like to briefly introduce or talk about such an analysis from a very qualitative and kind of artistic point of view. So here we're looking at a region near Dhaka, Bangladesh. We've heard a lot about Bangladesh already yesterday and the day before. So here you can see the Padma River, and we think that integrating such data generates new insights. So here we integrated with another data product called Global Surface Water Explorer that actually measures the dynamics of water bodies. And in this case, we see land that has converted into water from 1984 to now and the other way around. So green areas are new water bodies and red areas are new land areas. So if we overlay this now with population data, you can see where the major population densities are located. And if we overlay this with our age estimates, you can see blue are the older parts of settlements, and yellow and red are the newer parts. And if we now overlay both of these data sets, you can see, for example, this new patch of land that has emerged from the river dynamics somewhere at some point in the 80s probably, has been settled. People have built houses there in yellow colors, right? And these yellow colors correspond to approximately 1990. So you can see this settlement pressure and how people use such areas to build. On the other hand, you see green areas, newly emerged water bodies, how close they are getting to settlements, regardless if it's old or new settlements. So we're seeing here interesting patterns, interesting colors, but we need to keep in mind that behind these colors are actually populations and people that are living their lives and building their homes. Then finally, I'd like to conclude with some other applications of these data for emergency response and risk. So this is a screenshot of a quick response map that is produced by the JRC Emergency Response Coordination Center, where they report population estimates for individual disasters, and you can see these numbers are also coming from this GHS POP data set. Another example is the JRC Risk Data Hub. That is a tool that centralizes risk, damage, and loss data. They also uses exposure estimates from GHS POP. Here we're looking at the city of Valencia in Spain, and we can overlay this now with risk estimates, in this case specifically risk of river floods. As you may know, Valencia suffered from a bad flooding disaster earlier this year. And finally, I'd like to mention the JRC Inform initiative, which is another collaboration on risk, early warning, and preparedness that provides risk and severity indices via a range of dashboards and visualizations and other data sets that are all freely and openly available. And with this, I'm at the end of my presentations. A quick conclusion. So we've seen such settlement data are crucial for risk and exposure modeling. We've seen that the integration of these data can generate new insights. We're also working on further data disaggregation, looking at sex and age, for example. We're working on regional additions of the data to focus on areas or world regions of increasing relevance with respect to climate change, such as the Arctic. We're working on extending the data over time, working on spatially explicit models that measure or look at how population distribution may look in the year 2100. And we're also working on increasing updating cycles of our remote sensing derived input data. With that, I'm at the end of the presentation. Thank you very much.
Thank you, Johannes. Yes, please join me to the podium. Thanks for showing the baseline data and some disaster risk management applications. I would now like to invite Edgar Cartagena, manager of the National Statistics and Census Office of the Central Reserve Bank of El Salvador. He is an economist with a master degree in economic development and a master degree in business administration. Mr. Cartagena is going to present emerging vulnerability of urbanization, the Urba in El Salvador, and climatic findings. El Salvador was one of the countries that was supported by UNFPA and JRC to apply the degree of urbanization, so we are really interested to know more about the outcomes of that work. Mr. Cartagena, you have 15 minutes and the floor is yours.
Muchas gracias.
Thank you very much, and it's an honor for the Central Bank to be here. Thank you so much for when you visited the European Commission, and also with the contribution of the UN, we are performing applications on urbanization, and right now we would like to present a combination of the results that we have had on our census, populational census and living census that we had. Just to introduce here These are the past results of the census from El Salvador, and this is its composition. We have a higher proportion of women and a society that is also aging. Among both census, we have a population that has approximately surpassed 34 years of age. It is a population that in the aging index has doubled, actually more than doubled. They went from 20 to 49 when we compare to those that are above 64 years of age and 15 years of age. And we have a rate of dependency that was reduced as we have amplified the populational pyramid. And we see this in this pyramid, in the composition and the format of this pyramid. We are molding this in only 16 years. This reflects an important demographic data that shows a society that is aging, reaching the vulnerability data. This is what we are observing here. We observe a concentration of the population in certain areas with development hubs, as you can see in this map, where on the darker blue portion, which is the capital, that centers almost 100% of the population, according to the city and the department. Within the departments, we have 40% of the population, and in other areas of the country, they have a smaller proportion in relative terms of 4%. Regarding households, with the result of the census, we have registered more than 2 million homes. El Salvador is a country with 20,000 square kilometers, where we have 2 million households, and this represents 27%, which are centered on the capital of the country, San Salvador, and 19.7% are on the countryside. So we are once more centered on the capital than on the countryside. The households we have more than 2 million households in 2024 that were centered on the same cities, with 24% in one of the cities and 12% on the other one. So we are seeing households and populations where the main cities and departments of the country are centered.
If we go a little bit more talking about the usage, in the case of automobiles, we have an important mobility question in the country. And we found that 23% of the residents that said they had at least one car in the country are equally in the state of San Salvador, followed by another state, and many with a bigger concentration between these two states. We had an application now of the methodology of urbanization degree that has facilitated a development of some proposals and to have a better diagnostic of the situation of the country. One of the biggest conclusions is that 70.9% of the population is concentrated in 12% of the territory, and this means that there's bigger demands in service provision, mobility in these urban centers, and also gives us a vision of the needs and risks of vulnerabilities that are present for the country. The population in rural areas, therefore, is distributed in the 88% of the national territory, as you can see in the graph here. This here we have a bigger level disaggregation. We were at the first level previously, which are only 3, classification level 2 that are 7. And here we can observe once again with greater detail the heat map of the areas where you have a bigger concentration of populations or higher degree of urbanization. That's basically distributed between 6 centers, one of which is concentrating more than a fourth of the population. As we can see here, 23.1% of the population lives majoritarily in uninhabited or dispersed rural areas. One of the 6 urban centers that has allowed us to determine this methodology is the metropolitan area San Salvador, which is the capital of the country, that is expanding every time more. We can see how the red and orange areas are also integrating one into the other. And here we have almost a fourth of the population of the entire country, 24.5% of the population. As you can see in the orange area, it's an area that is expanding. This also implies mobility between areas. Here we're having combinations between the results of the census and also the needs and the areas of occupation. So areas where you have residents and areas that are occupied, and we observe states where in the previous slides we saw with lower levels of urbanization that are creating work towards areas that are less developed and less urban. For example, one of them that is in dark, the 17.2% of population of that state is moving itself towards other places, in this case towards San Salvador. We have 28,000 people that move towards another area. Here we are, the states that receive the most people, in this case is San Salvador, almost half of the total population that the other states receive is received by this department to occupy this state. Within the metropolitan area of San Salvador, which is what we were seeing in the heat map in red, there is a highly and very intense mobility. Here there's 180,000 people that would move around in a more micro way. 180 people that move on a daily basis from where they live up to their occupation area. We have used a methodology to undertake or create certain relations of vulnerability, which is related to this symposium subject. El Salvador is susceptible to natural risks such as earthquakes, inundations, floods, and droughts. And here we can observe the application, an app where they shows that almost 85% of the population is exposed to earthquake risks. San Salvador is between 2 tectonic plates. Now, linking the urbanization level to the information of earthquakes, we saw that almost 35% of the exposed population is in urban centers. Here you can see the red part that are the urban centers, and then the orange ones as well. And we can see how this is connected to earthquake threats that are high and moderate level. If we look at this also in floods, we have a coastal area towards the Pacific Ocean, and about 5% of the population is exposed to flood risks. Of these 5%, 80% of the of this exposition is found in the coastal areas. 41.7% of the population is at risk of floods in semi-dense areas, so urban centers, so connecting this urbanization degree level to these layers that facilitate us visualizing where the vulnerabilities are. Likewise, talking about droughts, 43.4% of the national population lives in areas that are susceptible to droughts. And within this, 17.9% is in the eastern side, which is the one that is in brown. Out of this, 19.3% of homes at a national level are exposed to the vulnerability of strong droughts, as you can see here with the different degrees of urbanization. 41.8% of the national population is therefore exposed to droughts to a high or very high degree, and also of landslides. And 12.5% of national population lives in the semi-dense locations, and urban centers are exposed to the likelihood of landslides. As you can see, these are apps that we are creating relating the vulnerability, climate questions to urbanization, that allows me to have a diagnostic. And with the most recent results we have for the population census, we can see and determine vulnerability degrees of groups, for example, of people that are more elderly, people that are living in the coastal areas, and the areas that are more susceptible to earthquakes, that are closer to the tectonic plates. And so it's an excellent tool that has really facilitated the creation of these interactions, have a better diagnostic in order to have social and economic policies that can be put into place. So I'll end my intervention here, and thanking once more the visit that you made to Salvador. And in general terms, this is allowing us to make a much bigger analysis on social and economic issues, using as base the degree of urbanization and also the pressures and demands on resources that happens because of this degree of urbanization.
Thank you very much, Edgar. I think it was a great example of leveraging national data, geospatial data, also coupled with, of course, the capacity of the NSO to conduct those analyses, but really is giving us a near real-time assessment of exposure at national level using a harmonized methodology. Let's not forget, census was conducted last year. So really exciting work. We now move to the second part of our session. We will have 3 discussants online for a panel discussion, and also the colleagues here. I would like to first introduce Dr. Sainan Zhang, Program Specialist, Population and Development Branch at UNFPA HQ. Maybe we can have the panelists online. Hello, Sainan, can you hear us?
I hear you. Hello, colleagues.
Good morning. Then we have Dr. Dana Thompson, Associate Director for Science Application at the Center for Integrated Earth System Information, CIESIN at Columbia University. Hi, Dan, are you with us?
Hi, everybody. Good morning, good afternoon.
Excellent. We then move to Malik Fida Khan, Executive Director at the Center for Environmental and Geographic Information Services, Bangladesh. Are you also online with us?
Yes, I'm with us. Can you hear me?
Absolutely, yes. Welcome.
Okay, thank you.
So let's move directly to Sainan, asking her What are the primarily methodologies currently applied to assess urbanization vulnerability in the face of climate change? You have 3 to 5 minutes, please.
Thank you, Chair. And so the primary methodologies to assess urban vulnerability to climate change, usually we call the vulnerability assessment frameworks. And these frameworks are not really standardized or unique. So basically, they are different frameworks, but have very popular 3 key components: exposure, sensitivity, and coping capacity. So the frameworks was originally introduced in the IPCC Third Assessment Report in 2001 and Fifth Assessment Report in 2014, so a long time ago. And since then, the vulnerability assessment framework has been widely adapted and adjusted, used by different UN agencies like UNDP, UNEP, UN Habitat, World Bank, and also other international organizations and academic. We also have the concept called risk framework. And recently, the popular called climate change risk framework, which is also widely adapted, is based on the 3 components: exposure, vulnerability, and the coping capacity. As you can see, the vulnerability is a part of risk assessment. So this has been used for vulnerability mapping and also disaster risk reduction. For UNFPA, we have adapted European Commission's developed Inform Risk Index. And we do the climate change vulnerability mapping and the risk mapping, including the 3 components as well. So for UNFPA, we mostly focused on a data-driven analysis to leave no one behind. And to be more specific, we map global population exposed to climate change hazard, like flood, drought, landslide, heat waves, or sea level rise, and aim to create a global population exposure database. Then at the country level, we are helping countries to develop use cases and mapping population vulnerability and climate change risk by incorporating population data, especially census data, which are geospatial data with each person's or each household's location, and overlay with other geospatial data, including climate change data, infrastructure data, like health facilities, road network, schools, hospitals, to understand people's vulnerability and coping capacity. So by this way, we identify vulnerable groups, especially with a gender lens, mapping women and girls who are disproportionately affected by climate change disasters in areas like food security, health, forced migration, and access to essential health services. So this is our work. We are now expanding this work, linking our climate change vulnerability to urbanization and mapping the urban vulnerability and the urban climate change risk. Urbanization and climate change are deeply connected, and it's also complicated. We can say urban areas are more vulnerable to climate change because it's the high population density, informal settlements, or urban heat island effect, particularly due to all the concrete and high density buildings, and also with the social inequalities. Especially we heard a lot about urban slums, and the rich and the poor, usually the gap are much wider in urban areas. And plus the location related, the urban areas, many urban areas are located in the coastal areas with a high population density and facing sea level rise. However, we can also say urban areas are more resilient because of its usually have a better infrastructure and have better drainage and have better health facilities and access to services. And so how to better understand the urbanization trend and its vulnerability and the resilience. It's all asked us to leverage data, have a better quality data and a higher resolution to disaggregate the data by population groups and by locations to identify the urban vulnerability and in the context of climate change. So to summarize, I feel to link urbanization and climate change vulnerability is our next steps, and it's very crucial, and we will need our efforts to engage with the local government and especially because it's in to integrate the different data from the different department and also stakeholders. So this will be our next work. The key to us is all about the disaggregation and the data integration. Thank you.
Thank you, Sainan. Excellent discussion across various topics. We will probably come back to that in the wrap-up. Moving now to Dana. Your work integrates Earth system data with population data sets. What innovations are emerging in mapping urban vulnerability, and how can these be used to protect SRHR and reduce GBV risk? Also yourself,
Okay.
Dana, you have 3 to 5 minutes. Thank you.
Thank you. Thank you for that question. It's not always just what, it's what and how, right? So we need great data. We need it to be disaggregated. We also need it to be fine scale resolution so that it's actionable in real places and real neighborhoods. But how we generate that data, how we validate that data is really important. And so I spend a lot of time thinking about process along with how do we generate routine, accurate, scalable, comparable data across settings. There's some fantastic global data sets produced by many of the agencies that are on this call and beyond. And certainly my center has been part of that crowd that has produced these very useful top-down fine-scale data products. But I'm through the, I'm sorry that there's feedback. Can I continue?
Yes, sure, absolutely. I switched off my mic.
Okay, thank you. So part of the Integrated Deprived Area Mapping Systems Network, or IDEA-MAPS network, we are thinking about how we can put these top-down data products inside of a data infrastructure that facilitates feedback loops between top-down modelers who can update a model every 6 months, every year, using the best available, newest GIS and remote sensing derived information, with local feedback and validations about the actual attributes that we're mapping. And so that those feedback loops are things that are showing up in the humanitarian sector already. For example, the International Red Cross has got a platform where they model imminent risks, and so they use this information to notify local chapters about an upcoming crisis that is likely to happen and start mobilizing people and resources, but they also use it internally to mobilize and prepare insurance schemes and loan schemes. But what's nice is once that local chapter has been mobilized to respond to, say, a flood, then there's an impact assessment that's performed, that data is collected, and it's brought back into the data ecosystem, and it goes actually into improving the next version of that imminent risk model. And so this kind of feedback loops in near real time can allow there to be adaptive data ecosystems. Climate is changing at rates that we've never seen before, and social phenomena and political and economic phenomena we know can be highly volatile. And so having these kind of rapid feedback loops in the course of a few months with lots of validation from the ground, whether it be communities or local governments, civil society, is I think really important as we think about having quality data that's informative and accurate at fine scale in the future. I will wait to talk about in my next question about some of the disaggregation by gender and how to think about gender in the actual attributes and processes.
Thank you, Dana. I'd like to move now to Malik. Bangladesh coastal cities are growing fast, yet many of the most at-risk residents, women, youth, and children, and climate-displaced migrants remain statistically invisible. How has Bangladesh combined disaggregated demographic data with geospatial climate hazard mapping to surface these hidden vulnerabilities? And what lesson can other low-elevation coastal cities draw from your approach? Also for yourself, 3 to 5 minutes. Thank you.
Thank you, moderator. First of all, I'd like to thanks for inviting me, which is co-hosted by UNFPA and the government of Brazil for this session. So as I'm representing my center is a knowledge institute which are broadly working in the field of water and environment and climate change. And our beauty of our center is having a big information system within our center at the national level. So we have a lot of, the climate information and also the risk mapping and also spatially in the coastal area. So still globally, Bangladesh is ranked in the 7th most climate vulnerable countries. And spatially as coastal zone as home of about 31 million people, which is around 28% of the total population of the country. So urban areas, especially in the coastal area, is very vulnerable. Still the rate of urbanization in the coastal area of Bangladesh is almost 5%, which is very high compared to if you see the global trend. And we have projected the coastal population, which is now 35 million, would be by 2050 is 58 million, which is significant urban growth that we are expecting, especially in the coastal zone. And unfortunately, these people are living in the coastal area in very informal settlement area, though it is a very disaster prone and also without having any kind of water and the security services. If you see in terms of the climate change, the sea level rise, from the CASE information that we have estimated that 3 to 5 millimeter per year, the sea level rise is happening in our country, which is almost twice of the global average of 3.4 millimeter per year. And also under the IPCC AR6 report, which is the emission scenario, the sea level rise could be the 25 centimeter by 2050 that we are expecting, and also the 1 meter by end of this century. So what will happen because of this, the sea level rise? We are expecting that 15% of the coastal land will be submerged, and the salinity intrusion of 1 ppt line will be further encroach 50 kilometers. So which is very, very alarming for our country. And at the same time, the recent statistics of the category 4 type of cyclone is increasing 10%. And also the IPCC also predicted that the cyclone intensity will increase by 10% by the 2050 in the high emissions scenario. But what we are already been experienced in the country, but especially the children and the women are very vulnerable in the coastal area. I'm just giving you one statistics. In 1991, there is a devastating cyclone, and 90% of the death toll are women and the children. And we are not able to evacuate because of the social barrier. Still many people live far away from the cyclone shelter to avoid. Why? Because to avoid them due to the safety and the social reasons. And as I have mentioned, the salinity intrusion is a big problem in our country, and the safe drinking water is a problem because of the groundwater salinization. Having the problem that we have done series of analysis, and especially my center for the coastal zone of Bangladesh, and consequently 9 key cities, which is covering around 10 million people, And we have identified with the overlay of the RICS map and the settlement area, and very interestingly that 40 to 50% of the smaller town in the coastal area are in the high risk category. So you can imagine that how the spatial data help us to identify what kind of people, informal settlement people are under in a high risk zone. So this risk zone is, we are preparing in my center. So having that, of information, I would like to 3 local assessments supported the 3 national initiatives, 3 or 4, but because recently we have prepared the Bangladesh Delta Plan, which is 100-year strategic plan. And also we have prepared the National Adaptation Plan for 2020-2050. And also some initiatives is the loss and damage framework that we are developing. The first of the National Adaptation Plan actually set the target for safer drainage and how to make the cities are in the cooler, and also the shelter that are accessible and safe for the women and especially for the children and the pregnant women. So that one of our targets is in our National Adaptation Plan. And the second, that we are also preparing the loss and damage framework that I have mentioned. These tools are actually the 3 steps, that immediate and medium and long term, to measure the both economic damage as well as the social impact like the health risks. So if you can able to combine the hazard map and the social data and the service support, claims that a new global loss and damage fund can be in the fund, loss and damage fund that we can access. The third is that we have just recently taken the initiative with the International Organization for Migration, IOM. My center is developing it the first time in Bangladesh in the national baseline of the climate-related displacement. It's a huge effort that we have just taken. So having that three initiatives, the simple 3 action that can help the other coastal cities, they're having the experience from our country. First is the map the people before the mapping hazards. We have to mapping, and we have a huge GIS and the remote sensing setups. So first we always do the mapping the people before mapping the hazard or the risks. And second, make the scoring method transparent when the hazard or the exposure and the sensitivity are measured using the simpler approaches, or the people trust the result and the planners that can be update them and the risks changes. The third one is the connect every hotspots to a real solution. What we are doing now, if a map show the flood risks or the heat stress, link with the specific action, like whether it is applicable for the shelter, whether it is for the water tap, or whether it could be a youth training program. So what we are trying to do, the connect with the hotspot with the real solution. I believe that this step help us move from the information to action, and also make it easier to attract the funding sources and explain the result to communicate with the different partners, especially the development partners. With these tools, any city can protect its most vulnerable groups in a clear and inclusive way. So that we are trying, and together I believe that we can turn rising risks into a rising resilience. So every children born along with our coast dreams of the school and the safety, not only the survival or escape. So that's for the time being my comments or my reflections about your question. Thank you.
Thank you, Malik, for this comprehensive review. I would like now to give the opportunity to our participants to ask their questions to the first round of presentations and interventions from our panelists. If there is any question on coming from the floor. Any of you working with geospatial data that have maybe suggestions for improvements, comments on fitness for purpose, or any other remarks? We have a question over there. And please introduce yourself and the person you would like to address the question to.
Good morning, I'm Raghu. I'm Chief of Health for UNFPA in Bangladesh. I don't have any question, but I would just like to say that the presentation was very impressive. A very technical stuff you guys have presented in a very succinct manner. But I think what I would just like to say that, we need to really simplify all this complex information that we are seeing through the graphics and visualization, so that it can be more usable and more accessible to people on the ground who might not understand the technicalities and the complexities of very, I would say, impressive graphs that we just saw. So that's my submission, to kind of, translate this technology into a very accessible sort of, format for people to be able to really use it. Thank you very much.
Thanks for your push to accessible and action-oriented data. Excellent. Any other remarks? Please.
Good morning, everyone. My name is Abina. I come from Guinea. I have a comment here, and I know that it's different here for us to redo when we see the politics of urbanization in our countries, to truly show this data to all of us. And regarding my country, there are other factors. Overall, the concentration of base services at the urban level zones, where people have to leave further zones to have access to such services. Another point is the urbanization plan established at a local level, in which we can't truly go throughout the city as it's all centered. Perhaps this data may give an idea of urbanization to our governments. Thank you so much.
To Sinan or Johannes, or the experience from our colleague Edgar. Please, anyone who wants to address that. Maybe Sinan?
So is the question mentioning about the UNFPA's support on the, I see the questions on the chat regarding to make the health center safer?
I think we can reflect on the methodology fitness for purpose in various settings, including the specific case of Benin. So, for example, African cities, you can tell us about the regional workshops that we have done in the region.
Yes, for UNFPA, we're supporting on this the data and the methodology, and periodically carrying out the capacity strengthening workshops. We recently have one on the definition of degree of urbanization in Africa, and we are also supporting countries on the data and the standardization methodology on mapping climate change vulnerability, and support on the utilization of sensors using geospatial analysis, and how to integrate population dynamics into urbanization and climate change risk mapping. So all these are the work that UNFPA is currently carrying on, enhance the country capacity.
If I might jump in and respond to the speaker from Benin. So IDEA Maps, the Integrated Deprived Area Mapping System, is really a collection of multiple slum mapping traditions. And we've been a hodgepodge crew. About 10 projects over the last 5 years have been implemented, and there's been a tremendous amount of co-learning through this process. One of the key takeaways, we started really with this intention to support SDG 1111% of urban population living in slums, informal settlements, and inadequate housing by producing spatial data. Communities and local governments really were not that interested in having this kind of generalized map. It's really the international and national stakeholders that were interested in these maps. At the local government level and even communities, they were interested in the underlying conditions that define deprivation itself. And we think that it's much more useful if we're characterizing, that we're actually mapping characteristics that align with the departments of local government, because there's already ongoing conversations around upgrading water, upgrading roads, upgrading and dealing with waste management. So these different kind of city functions and departments, and supporting those existing conversations or potential conversations with concrete data that ultimately can be combined to define slumness or informality. But actually really focusing on those underlying conditions that align with city department functions is really the direction that we've been going in idea maps.
Thank you, Dana. Maybe we move to Edgar for his perspective as well.
Sí, gracias. Quizás
Thank you so much. Well, for the technicalities, from the central bank, we present reports, complementary reports, so it's more understandable. The enormous amount of geospatial information that was presented to determine the recognition of the urbanization areas. The results that we have obtained were 100% digital, which helped us to create all of these geo-referential mapping that helps us to have the information of urbanization and, as was mentioned, a higher demand for original resources in places where urbanization is much greater, so the needs are much greater. But there is also a difference with rural areas that also need access, as they need to face further distances to provide for providence. And this methodology allows for us to have diagnostics and facilitates our proposals for determining the best way to analyze and get close to these urban centers and to see how they will expand themselves and develop themselves throughout time towards urban centers. And this will increase and will create a need for provisions. So it is important for it to be, regarding the experience of El Salvador, to have this georeferential basis with updated data that will allow for us to be perspective, to facilitate coordinations coming from the base that we are creating in the central bank. Thank you so much.
Can I just quickly Malik? So please, Malik, be concise in addressing them. We have some more here in the room. Lars is asking, do you have programs that makes health or SRH centers safer? How? And if that is together with UNFPA. And the second question is from Dauda, and is asking if you have any programs that address the impact of climate change on the lives of young people and children. Back to you, Malik. Please be concise.
In the last questions, yes. If you see our national adaptation plan, so that is not only, this is also gender inclusive, as well as for the young and the women are inclusive in our national adaptation plan. And your first question, sorry, what is his first questions?
The question from Lars is if you have any programs to make health and SRH centers safer. If so, how, and if that's together with UNFPA?
Yeah, I believe that it's possible, the center and with the UNFPA in Bangladesh, because you see in Bangladesh that we have an advantage of, you have, a lot of, the geospatial information. As one of the comments from the unit that mentioned that the information should be accessible and it should be easily translated so that people can access and people can understand. And that we are doing in our center, the transformation and translation of the geospatial information so that any action can be taken on the basis of this geospatial information. And we have all this information for all the coastal districts as well as other part of our country.
Thank you, Malik. Let's move to another question from the room. Yeah.
Okay. My name is Bayan Abdirrahim. I'm an environmental specialist specializing in renewable energy and climate change. I use GIS in my study, but I have a question to make our discussion more inclusive. What kind of data could we use in the country that suffer from war side by side with climate change? And could we have a call to action to have a guide data tools specializing in this issue? Thank you.
Thank you for your question. Any of the panelists or online people would like to address that, please? Dana, Johannes, anyone?
I can jump in, maybe to the speaker's point. It's not just what, it's what and how. So there are specific data sets and tools that can be more gender inclusive and specifically measure and center violence that is experienced by women and LGBTQ people. So we can be thinking about those specific indicators that define and characterize deprivation. Even things like infrastructure sometimes have a very gendered component. Nighttime lights are experienced differently by men and women sometimes. Road and transport systems can be experienced very differently by people of different genders. Contamination and pollution might affect people based off of their occupation or places of exposure or the consequences on their bodies in terms of health outcomes. So we can be thinking about how to map and measure those particular indicators, the what, but the how is still very important to me. And I see women as, it's really important to have women centered in the process as data collectors and data storytellers, right? To enable the advocating for the issues that matter, framing the issues that matter, and also providing pathways into livelihoods and independence and confidence and social power by being data collectors and data storytellers.
Thank you, Dana. Any other feedbacks from our panelists? Okay.
Yeah,
Go ahead, Dasainen.
I think overall, you mentioned about all this data related to gender, SRH. It's overall kind of challenging because most of this data are collected through survey, not census. So they not really have the data for everyone, but it can only cover a relatively big area, like a province level. And then we don't have data when we go down to high resolution. But to study urban vulnerability, the high resolution data at a local level is so important. It's hard to tell currently whether we already have tools or any guidance to better collect the data or use the data. But of course, this is UNEP's priority areas on supporting countries on both collecting and use data, including developing different tools or especially automatic tools. So I think with the technology and then the shift to all this new methodology, for example, small area estimation, this is also one area we are supporting. Once we have the data at province level, we integrate this survey data on GBV, and which HIV or gender-related data with population census and with other geospatial data, we can estimate the indicators at a local level. So that's we are supporting on data generation. We're also supporting on the use of data by integrating to develop tools like automatic calculation tools, incorporating this gender data with population, with climate change infrastructure to better understand people's, for example, geographically access to health facility. What is the walking distance within a walking distance of health facility, and how many women and girls is covered. So this are also possible. We have existing tools and existing method. We are training countries on use of the existing the mapping tools and the methodology. Yeah, for example, smart estimation or access mode, the measure people's access to health facility. All this we are supporting to informing countries on how to use them.
Thank you, Simon. Any other questions from the yes, please.
Thank you very much. This is Professor Dr. Iqbal Kabir from Bangladesh again. So thank you very much, Jonas, for your deep data analysis regarding the Padma River and GHSL. So I found it very much interesting, as mentioned by Malik Fidavai over there. He is very much the mastermind behind the National Adaptation Plan. And based on that, we have developed now comprehensive climate change health national adaptation plan. So predicting based on your data set regarding from 2015 to 2030 projections regarding the river side, along with the coast side as mentioned by Fida Malik, now we can assume that in 2030 perspective, what will be the share of SRHR population and how we can utilize that regarding heat stress and other climate shocks. So how we can bridge, we always talk about connecting the dots. So your findings with Fida Malik's findings, and then IOM is working on, population SRHR service with the displaced population. So how from the health perspective, we can have an inclusive way to, develop an early warning system for SRHR component, and as well as, the climate shocks among women and girls. Do you find any, because you are using the remote sensing data sets, so using those data with the population, with an epidemiological approach, how we can further make it, as mentioned my good friend from UNFPA, that how can we make more palatable for, quality service delivery targeting SRHS services?
Well, yeah, thank you for this question. So, I think what you are talking about is very much a challenge that is lying ahead of us, right? And so what these global data sets do, they use, as you said, they use remote sensing data. So what we see from space combined with what has been reported by the census, combined with estimates of projections from the UN. So this is a global data set, and of course, locally, it is still based on these global data sets, right? And, the challenge is indeed to integrate these data sets. As has been said yesterday, also data integration is key for these challenges, and at the same time, it's a big challenge. So, from my perspective, what these data provide are the overall kind of universe, right? So they show where are buildings, where are people, and further information, disaggregated data. This is of course something that needs to be done in a local context or at the country or regional level. So I cannot really give a solution to your question, just to emphasize the need for integration and for innovative strategies to integrate different data sources.
Can I supplement to his question? The example is given by. So what my center is doing, every year we are projecting or we are forecasting that how much area will be eroded. For as example given by for the Padma, that we are not doing only the Padma, we are also providing the information, the riverbank erosions for the Jamuna, Padma and the Ganges. What is the beauty of the geospatial data? So we are not providing or predicting this data only for the as a number, like this hectares of land will be eroded. But what we are providing as well, that we are also providing how much settlement area and how many settlement or the homes will be eroded and what kind of other infrastructure will be eroded. That information that we are also predicting. I believe that this geospatial information we can integrate with the global information, so definitely that we can, give some kind of information or how many children or how many women in each household will be, the landless or the homeless. So that is the best way, integrate the spatial information and the attribute information that we are doing every year for the major river. And that we are also predicting from the next year for the other 12, the medium class river in Bangladesh.
Thank you, Malik. We have another question from the audience here and then one online.
Good day, everybody. Nicole Hendrickson. There's a report of the innovation of the smart maps for smart cities layout, the fast-growing need for rapidly growing urban populations in India. It's been used in two ways. One, in terms of making women safe in new cities, and another way as a possible early warning system. But my question is, what role does techno-colonialism play in smart mapping making? And what ways do maps as forms of archives in cities and landscapes, thus people get further control through a smart, AKA digital version of it? So I guess that yes, we appreciate the technology, but then how do we get controlled by it? And also too, the safety around using it, either women versus men.
Thank you for the question. I think this is some material for Dana and maybe Edgar on the national application of global methodologies. I would also add a comment coming online asking about vulnerability of boys and men is increasing and impacting not just their health but also social behaviors. And the question is about how can we improve research and programming for those groups. Maybe also it can be addressed by some of the panelists. Anyone? Tough questions.
Sí, pregunta difícil, ciertamente.
Pergunta difícil, sem dúvida, talvez para o caso do Salvador.
Hemos hecho una transición sumamente
Então, submetido importante. So, we have an important thing that was based on the location of churches and mayories and international methodology, and this facilitated the possibility of interacting with the results of the census. And so what you can apply through specialized teams on databases, so the geospatial teams, allows us to create these apps can take you to a bigger dimensions for economic and social policies. We are doing a combination based on census. They're 100% digital of locating each of the populations, the structures, and how you place them in the maps, and so the social demographic characteristics for determining patterns, and also visualize actions that are necessary, that must take place. The combination that needs to be developed for the vulnerable groups and aspects for climate change and situations of environmental impact facilitate the application for geospatial development. Algum comentário dos... any...
If I might jump in, I'm formulating my response to the earlier question around how tech can, especially in smart cities, can be leveraged instead of in a non-colonial way, in a more empowering way. And it's making me think about just the broader framing that we often hear in these data spaces. We either have top-down data that are produced globally, integrating, say, remote sensing, census, and other large coverage data sets, or we have bottom-up kind of community-generated qualitative kind of data. Another framing is we can either have coarse, globally comparable data or kind of very accurate fine-scale data that's very intensive to collect on the ground. And I think it's more, I don't have all the answers, but I certainly am interested in thinking about how might we actually integrate these? Can we actually co-produce data at scale? Can we think of citizen-generated data as not just a random collection of very disparate data, but can there actually be some structure brought to it so that it can be incorporated into global data modeling ecosystems? And so in the chat, I've put a link to the CODATA Copenhagen Framework on Citizen-Generated Data and Official Statistics. And I've found this group really interesting to follow because they're not, again, not having particular solutions or techniques, but they're giving some guardrails around what that might look like to have lots of citizen-generated data. And I think in the Idea Maps network, we're trying to think how to operationalize this a bit. How might we put data in front of people that are modeled in a top-down, remote sensing, small area estimation, census-based way, knowing that there is going to be lots of error at local levels, but assuming that there might be something useful, there might be some signals in the data, and then getting feedback. Not only is it right or wrong, but is the estimate high, low, or about right? Something like this, that we can integrate from lots of different people, and we can't be necessarily asking people to just go out and validate data directly. Like, the data needs to be put inside of tools that people are using in their daily work and operationalizing somehow, right? And in the act of using that data for something, they have the opportunity to feedback on it somehow, and that feedback is captured and brought back into the data ecosystem. This is, it's a little bit pie in the sky thinking, but this is the direction that I think we should be going, and certainly thinking about how to, really get on the CODATA train and really think about how to bring citizen-generated data and package it so that it can be integrated into the rest of these global data products.
Thank you, Dana, for that enlightening perspective. I think we had a whopping 30 minutes discussion. I think it was like a record in this conference. So I think it was a good sign. Maybe I'd like to ask all the panelists and the presenters to have their concluding words. So we will not run a second round of questions. Maybe some concluding remarks from all of them, and then I will not intervene anymore. Maybe we can go online with Sinan, then Dana, Malik, then Edgar and Johannes. Thank you.
Yeah, I would say the vulnerability mapping is a very complicated issues, and also address one of the audience mentioned about the boys and the men. And indeed, while we talk a lot about the gender issues, we are focusing a lot on women and girls, but the men and the boys also could be overrepresented in high-risk climate related jobs like construction, agriculture, fishery. And so when we talk about disaggregation by gender, we look into women and girls, but we should also not neglect the boys and the men. So when we mentioned the vulnerability framework, there's an overall mountain hazard vulnerability mapping. We also wanted to use this opportunity to highlight we should also have a hazard-specific vulnerability mapping, because different hazards, chronic, acute, they really affect the people and different groups differently. So that's back to these complicated issues, especially when we project to future what has a future vulnerability and the people's exposure and a risk to climate change. That added another layer of complicated data on the projection, because both environmental data, population data, they are dynamic over time and over space. And so we are continue to work with other UN agencies and closely collaborate with local government to enhance the data accountability and data quality, and develop the new and using new and innovative approaches to measure the vulnerability in a more accurate and a better way to inform the programs and policies for adaptation and disaster risk reduction. Thank you.
Thank you, Sainan. Let's move to Dana, asking please to stay within 1 minute, please.
Sure. I'd like to echo and pick up a thread from one of the audience members who said that we need a kind of call to action or some concrete next steps. And I couldn't agree more around like the need for frameworks, approaches, tools, methods, kind of some kind of statement or compilation of ideas about not only how to do gender disaggregated data, because we've got, I mean, there's lots of mandate for that now in the SDGs, et cetera, but how do we actually do that other than just modeling and applying pretty broad assumptions about, you know, age, sex distributions and then coming up with a number? You know, how do we properly disaggregate gender data for local spatial scales, and also thinking about the actual how attributes are gendered themselves. It's not just data that are disaggregated by men, women, LGBTQ, and heterosexual, homosexual, these kind of things. It's thinking about how the characteristics that we're mapping are experienced differently by people of different genders and why, and really kind of putting a framework around that. I think that would be a useful next step, and happy to contribute.
Thank you for the contribution. Now moving to Malik.
Yeah, I just want to, highlighting the 4 model that we are practicing, which could be scale up in other countries also. First is the cyclone shelter. As I have mentioned, that the cyclone shelter is more, the gender responsive. And this is now a reference in our national guidelines. So these are more, in terms of accessibility and the acceptability. And that could be also, replicate in other countries. The second is the early warning and evacuation. So our cyclone preparedness program is now world's largest gender balanced disaster volunteer network with over 76,000 members, and half of them are the women. So this is also a unique example in our country, and they are playing, the women are volunteer playing a very critical role, reaching to other women during the emergency. And recent experience in Amphan, one of the cyclone, the 2.4 million people were safely evacuated in only 5 days. And that is also, a good grassroots level model. The third one is the climate resilient health services. So during the disaster, often disconnect the access to the healthcare center. So what Bangladesh is doing, that we are addressing this issue, introducing the mobile health clinics, the boat ambulance, and the flood-prone regions, especially essentiality of the floating clinics. And that is also a good example of the climate resilient health services, especially after the flood. The fourth one is the water sanitation and hygiene. After the disaster, women face unique wash challenges and lack of safe toilets. And that is also, we are prioritized, and that's why we have prioritized the flood resilient tubal or elevated community toilets and solar lighting system.
Malik,
and
please try to conclude with the punchline.
Yeah, we in support, we also for the help desk by female officer and now placed in the shelter, cyclone shelter and the camps. And our Ministry of Disaster Management also distribute the dignity kits, which actually hygiene supplies and also the flashlights. After even the floods, I believe that if you can upscaling this poor model, which can also be placed in our national adaptation plan, and we already been mandates the gender responsiveness, and I believe that that can also be replicated in many other countries, especially in the South Asia.
Thank you. Thank you very much. Edgar, please, your final thoughts.
Thank you.
Another important theme is how can we use
a humanitarian crisis is looming in Tana River County as floodwaters continue to sweep villages.
Are 100% digital. This is fundamental, and we are using that greatly. And with that, the development that is being performed in matter of geospatial assessment in different groups is really important for the application by governments on geospatial analysis. This is fundamental for analyses, the combination that is possible to perform among the results of the census with the geospace analyses, and those that allow to determine the grade of urbanization, and in the future how to formulate economic and socioeconomic policies. We can see how broad applications in different themes, and this development on our side, we are using that, and we are seeking to potentialize this in different areas with the past results that appear. And finally, thank you so much for the European Commission, the Population Agency of the UN, for the follow-up, for the help that they gave us in El Salvador. And we are seeing part of the results that we were able to implement with these methodological developments and the strengthening that we have developed on geospace analyses and also on the grade of urbanization. Thank you so much.
You are separating us from coffee break.
All right, so I'll keep it very, very short. So just want to put the focus of my final concluding remarks here on, again, also on the importance of the physical aspects of vulnerability. Buildings, right? So buildings are where people live in, buildings are where people seek shelter in cases of flooding, in cases of heat, etc. So also the limitations of data, for example. If we look at vulnerability of certain populations to heat waves, for example, we need information on building age, on building insulation, on energy efficiency of buildings. All this is information that can only to a small degrees be obtained from space or from commonly used geospatial mapping technologies. So community-based information, local administrative information, and the integration of community-based information with global data, I think that's really the key here to advance on these topics. And thank you very much.
Thank you very much, everyone. I think a concluding sentence would be technology is nothing without partnership. So I think we can really look forward for more integrated and successful implementation of technology measures. So thanks a lot. Enjoy your coffee break. I was told we have to come back by 10:45 for the next sessions. So enjoy your coffee break, and please join me in applauding our panelists and presenters.
Muito bem.
Very well. Please, let's take a picture of the panel, and we inform that yesterday someone forgot this notepad and a pen. If it's yours, oh, we found the person. You can come here and get it later on. Oh no, they're taking it to you. Okay. Very well. Thank you so much, Michelle, and for all the panelists of session 9 for this crucial discussion on emerging vulnerabilities of urbanization and risk reduction approaches. Very well. Now let's do a 15-minute break for our coffee break. Please use this opportunity to exchange information with other partners, networking, and we will come back in 15 minutes. Let's go for the coffee break.
A humanitarian crisis is looming in Tana River County as floodwaters continue to sweep villages starting from Bura to Garsen constituency in Tana Delta.
Climate change has really affected our county. First of all, being in the river flood areas, traditionally we could predict when the floods come and when the dry spells are and when the other flood comes. Today it's unpredictable. Unpredictable in the sense that you expect maybe rains to start April, May. Rains come in October, when maybe the farmlands are just about ready to be harvested. What happens? Spoiled yields, spoiled production, which means we might not be able at that point to be able to predict how much food we have during the dry spells.
Nilikuwa naishi huko Kiazini. Maji yalipokuja yakaanza kutuhangaisha. Tulikuwa tumepanda mahindi, pojo na kunde. Maji yalipoanza kuingia, tukaanza kuchukua mahindi, lakini maji yalikuwa mengi, hatukuweza kuyachukua, mengine yameenda na maji. Wanyama pia tulikuwa na kuku nayo yakaenda na maji. Tukatembea tukaja hapa. Shirika la Red Cross ndio likakuja. Walipatupatia sufuria, tarbala na chakula.
Tulikuwa tumelima ndizi, magomba na tulikuwa na mifugo, kuku na mbuzi na ng'ombe, lakini sasa maji yakakuwa mengi, ikabidi tutoke huko tuje huku.
Today we are experiencing floods, and it's not because Tana River has rained as a county. No, it's because conditions upstream have changed. What we had was lots of waters coming from the dams when the dams became so full. So we got a swollen river, which busted the banks and basically pushed the riverine dwellers to safe areas.
In Tana River County, we observe very critical levels of climate change-induced disasters. The county has just evolved from a prolonged drought to severe floods that have claimed quite a huge number of people in terms of displaced populations and populations that have been cut off from basic subsistence sources.
Kama mimi mjamzito huwa nalala chini, manake vile vitu vya kuwa nitatandika nilalie hakuna, na watoto wangu itabidi tufunge mahali tulale. Red Cross wametuletea neti 2 lakini kulingamana na wale watoto nilionao, zile neti hazinitoshi. Kuna wanyama msituni, maninge, nyoka, time nyingine tunaweza tunalala, mtu anapita anasema ni nyoka, ikabidi watu watoke tuue huyo nyoka ndio turudi kulala na ni chini. Kama mjamzito inatakana ale vyakula bora, si vyakula unapika simu, unapika pojo, unapika nini, lakini kulingamana na ile hali itabidi ule, manake hakuna chakula na hakuna budi ya kwa utafanya, itabidi ni kula hivyo hivyo.
Proximity and the safety of the girl child, safety of the women now is wanting. And that now becomes the genesis of sexual abuse and gender violences, because now the couple they don't have their own privacy. So what happens? Again, it's a psychological thing. Things like this might happen in terms of somebody being violent. The man might not be able to produce what is required on a daily basis for the family. What does that do? Frustration. The mama who maybe had everything she required to take care of the home, utensils, clothing, whatever, all of it maybe went with the floods. Again, it's frustration on the woman. What happens is misunderstanding. Misunderstanding leads to maybe some violence.
There is still a huge gap in terms of the services that IDP populations in Tana River County require. There was a bit of significant response to the situation in Nairobi because of fairly good access to services and the presence of many actors in the city. Unlike here, which is a rural location, fairly cut off, and therefore it has been a challenge for many actors to step in and mitigate the situation the way it has unfolded in Tana River County.
Changamoto, tunalala kwa matarbala na kuna wadudu wabaya. Sasa tunaomba mtusaidie, hata kama kutujengea nyumba ili tusaidike. Maji yakija tutakuwa tuko na nyumba zetu, tukienda shambani akianza kuja maji tutakuwa tunaingia kwa nyumba. Na pia tunaomba tusaidie na pesa. Nikienda kujifungua lazima sina nyumba ya kuishi, nije niingie hapo kwa tarbala nikae. Na mtoto lazima atakunywa vumbi, ule upepo lazima atashikwa na pneumonia. Sasa ilikuwa naomba serikali watusaidie, kama pengine kujengea nyumba watutoe huku watupeleke mbele ya kwa pengine tutapata makao.
Solutions are there, and the solution is to go to higher grounds. Higher grounds, defined higher grounds, because as a county we have a GIS station, and we know historically which areas are islands and water will not reach there. But again, when it comes to convincing, we have to convince the locals, because traditionally they're used to live near the riverbank. How can we assist these families to establish new homes, okay, wherever we are showing them? Maybe that will make them stay. And then we also give them the services which Ibn Maroon will give them on the higher grounds. That now there is no need to go down to the river. Not just give the food and go, no. Not to give the mobile services of healthcare and go, no. Let's build the infrastructures on the higher ground. Let's provide water, potable water to the higher ground. Let's provide the primary schools on the higher ground. The county government cannot do it again alone.
In the long term, what do we want to see in Tana River? We want to see resilient communities. We want to see policy architecture that is in a situation of anticipatory action. We want to see service delivery that is climate proof, so that it's not just a matter of response every time when there is an emergency. We are confident that if we work with other stakeholders and focus on the priorities that we have identified in the country program, jointly developed by with the government of Kenya and other stakeholders, we should lower the vulnerability that is there during disasters and build healthy communities that are very resilient.
Ele é o moderador, né? Your name, the last name, pronunciation. Vibhavendra Raghuvanshi. Yeah. Let's start. Muito bem, senhoras e senhores.
Very well, ladies and gentlemen. Welcome back once more. I hope you had an excellent coffee break. Our session now will focus Welcome back once more, those who are online and those who are with us in person. May you be seated right now. Our next session will focus on populational integrated data for climate action, early alert, and anticipatory actions. Data are the pivotal pillar for education based on right. In this session, we explore the critical role and practical application of integrated populational data in strengthening climate action, enhancing early warning systems, and informing anticipatory action strategies. It will also showcase practical examples and best practices for leveraging such data efficiently. To guide us on this discussion, I would like to present the moderator of this panel, Vibhavendra Raghuvanshi, Chief of Health of UNFPA in Bangladesh. The floor is yours.
To Director of Ceremonies, and good morning to everyone. It's my pleasure to moderate this session. As just said, I am Vibhavendra Singh Raghuvanshi, Raghu. I'm the Chief of Health for UNFPA Bangladesh. I think in the succession of the programs that we have been observing since yesterday, I think we have come to a juncture where we are in session number 10, which is about integrated population data for climate action, early warning, and anticipatory actions. We have been looking at the importance and the centrality of data all these past 2 days. I think this is yet another session where we are going to deep dive into the importance of data in climate action, in climate justice, and an integrated approach to the problems which climate change is posing, not only to the humanity, but more specifically and more pointedly at women, children, and vulnerable groups of the population. We all know that climate change exacerbates vulnerability in the form of it increases poverty. People who are poor become more poor. Inequity gets challenged. Inequality increases. We also see that exposure level also becomes diverse, becomes unique for people who are in vulnerable situations. We also see that the disease and the prevailing health status of individuals are getting worse by the climate changes. And all these are increasing the vulnerabilities of different populations. And it is in this context that we know that this population group, the vulnerables, are least prepared to respond to the loss and damages which the climate change is incurring on them. They don't have the means to respond to the changes and to the situations that they are being quite autonomously being pushed into. It is in this context that the vulnerable people by individual characteristics, vulnerabilities because of the geographical locations where they are in, vulnerabilities because of the specific communities in which they are living, they become most critical to be addressed. It is in this context that climate justice, intersectoral response, prioritized intervention becomes so important, so that we provide them the wherewithals, the ability to be able to respond and to able to really get empowered to handle their situations in the context which is much beyond their control, which they are not at all responsible for creating. And in this, data becomes very important. Data gives us information, and this information helps us to plan better, to kind of have better interventions, targeted interventions, which are able to create a situation where they are able to respond to the losses and the damages incurred by the different hazards that they are facing. In this context, population data, geospatial data, their superimposition, as we have been seeing in our previous presentations, that it's not just about specific data, but it is about data from different aspects, from different sources. Their superimposition becomes so very important. This type of integrated data of first trying to have individual data and then superimposing them becomes very important, and then it can really provide real solutions and real hope by way of having better climate actions, by way of having a better anticipatory actions and early warning system. So in this context, let me just very briefly share the objectives of this session, which is to understand the importance of the integrated data in early warning systems, anticipatory action, and also in having climate actions. The second objective of this session is to hear from countries about their individual context and the best practices and the programs and interventions that they have established, which might be useful for the global community at large. Finally, to also critically look at different frameworks, the indicator systems, and the mechanisms which exist to really measure the role of data and its superimposition on providing better solutions. With this, let me invite the distinguished panel onto the stage. And as with other sessions, there will be two key presentations for 15 minutes each, followed by 8 minutes each of questions to the distinguished panel, and then finally some question and answers. So my first speaker for the session is Michelle Michiori, who is the Project Officer, Disaster Risk Management Unit, European Commission, Joint Research Center, and he is here in person, and we have seen him moderating the previous session, so may I just invite him here on the stage. Let me just very quickly also, you can take the other next seat, yeah. May I also just acknowledge the presence of Animesh Kumar. I guess he is available online to do the second keynote presentation. I don't know, Jack Amina, who's one of the panelists, is online or is going to be here in presence. If online, then we will connect to her shortly. Then Meghnath Dhimal, I would also like to invite him on the stage. He is Chief Nepal Health Research Council, Nepal Ministry of Health. Nabila Purno, who is a PhD student at Johns Hopkins, and earlier she was a staff, a colleague in UNFPA Bangladesh. We also have Jahanara Saeed. I don't know if she is here physically. Otherwise, I think she will be joining online. She is Program Manager, Women's Environment and Development Organization, Gender Plus Environment Data Alliance. So with that, let me just invite now Michel for his presentation. You have, Michel, 15 minutes.
Thank you. Thank you very much, and good morning again. First of all, I would like to acknowledge the kind invitation of UNFPA for us to be here and present our experiences on several intertwined aspects relating to human settlements, climate change, exposure, and vulnerability. Can we have our slide? Thank you. So the Joint Research Center is the so-called entrusted entity, that means implementation body, of the Copernicus Emergency Management Service. Copernicus is a multi-billion European program to build autonomous capacity in Earth observation, not only with a space segment, so constructing and operating satellites, but also to develop and operate services, thematic services addressing global societal needs. We can start by understanding that human settlement information is essential for policy frameworks across different thematic domains. So not only sustainable cities, not only sustainable development, but most of all disaster risk management and sustainable development goals. This is why at the Joint Research Center of the European Commission, about 10 years ago, actually more than 10 years ago, a project named Global Human Settlement Layer was established to really map human settlement on the planet over time, mapping buildings, populations, and their characteristics. At the JRC, this information is used for all the components of the Copernicus Emergency Management Service that include rapid and risk and recovery mapping, flood, hazard, and early warning, fire, hazard mapping, and early warning, drought early warning as well, and our latest component, that is the exposure mapping component. That is really a global baseline of population and built up that is used across all the other components and across different services of Copernicus. What do we mean by exposure? How is it used? And why do we think it's important? Well, exposure is key in early warning systems. We can only, let's say, send alert to people that we know that live there. So this is where information systems such as the drought information system for early warning or the flood alert early warning system for Europe is key. Then at global level, several years ago, one of the first efforts of our unit was to establish the Global Disaster Alert and Coordination System. That is really a multi-stakeholder platform that integrates alerts for and warnings for different type of hazards. It really maps them, it quantifies exposed population, and it's also really used by responders to coordinate. Another important pillar of exposure is in rapid damage assessment. When disasters strike, we need to prioritize areas of intervention, quantify resources needed in the Union, but also at global level through various departments of the European Commission. So this is where high resolution disaggregated data on human settlements, post-disaster situation images, so real-time or near real-time acquisition from satellites, are overlaid with population and built-up area to quantify impacted population, also the size and the magnitude of damages. But also we have continuous work on risk assessment along the line presented by my colleague Johannes before, where we really construct a global baseline, a global information system about population, built-up, and hazards. These come into play in the context of Copernicus. As I said, it's a European effort that is built across 6 cross-cutting thematic services, one on land monitoring, another on marine, atmosphere monitoring, climate change, security, and disaster risk, so emergency management. Those services really coexist and integrate their strengths. They all produce open and free data across different thematic domain on land use and land cover. They are used to estimate the food production and so on. In the context of emergency, the global human settlement layer is a key resource. First of all, the main effect, the main component is that it's based on a continuous update principle. That means every 2 years, these baseline data on built-up and population is updated, making sure that up-to-date global information is available and made accessible in an open and free way. It's also an ecosystem of products. That means we not only have maps at high resolution of built-up, but we also have flexible products that include analytics, but also different versions, or if you work with a specific coordinate system that is taken into account. Also very important to note, it's quality controlled and validated, and it also includes greenness layer, so to map the presence of green in human settlements. This is then used for specific thematic applications that we will see in a moment. In this slide, I want to express a sort of transition from information, so large volumes of unstructured data that come from satellites. Those are the images acquired by satellites. They are transformed into valuable information by technology, by algorithms, that really use those images to map settlements. With the integration of sensors and surveys, they become population grids, as presented by Johannes. And then at this level, we see already the value of data integration, so coming from different streams, different sectors. We combine those into so-called models or new knowledge. One of the examples is the settlement classification, the degree of urbanization presented before, where we really try to harmonize information and populate those typologies, those settlement types, with a series of attributes. So characteristics of the built environment, characteristics of people, data coming from the climate service, for example, so about temperature change, about sea level rise, and this product is then the so-called urban center database. We said about what we mean for exposure, but how do we make exposure analytics? This is probably the most complicated slide in my presentation. The concept is we have input data, they are people and built up, and then we have a series of potential overlays coming from hazard data, cyclone, earthquake, tsunamis, storm surge, and flood. The overlay of people and buildings and those hazard maps can be used to obtain analytics, not only of the present time, so what is the population exposed to floods in Brazil in 2025, but also to analyze over time how this exposure has changed, and most of all, integrating that with population projection or hazard projection can tell us what is going probably to be the situation in the future. This, of course, goes hand in hand with the Sendai framework for disaster risk reduction priorities of trying not to create new risk with development. Going on, This work of the previous slide was conducted some 7-8 years ago. What is next and what is needed now? So we need characteristics of buildings, characteristics of people, because as we heard several times in this conference, not all groups are impacted the same. Not all buildings are also affected in the same way. We can say that there are a lot of tall buildings in Japan, but let's say the risk or the vulnerability in that place is not comparable to other places of Southeast Asia. I have in mind Nepal, for example. So really, we have to combine efforts to integrate data to really come up with built-up and population characteristics. Johan has showed something about building height, building age, and also we are working in the framework of the Group on Earth Observation on built-up characteristics, so materials, dominant materials of constructions. The second level is to address also the human dimension, directly targeting population, so population grid in the form of density, so number of people per square kilometer or per hectare using higher resolution. And then this is used to obtain harmonized delineation of settlements. And as Edgar mentioned before, and also Sinan, why do we need harmonized data? We need that to make it possible to compare levels of exposure, but most of all, come up with coherent policies and assess and evaluate those policies. In the context of the global human settlement layer, this was addressed with the urban center database and the degree of urbanization. That is why 6 international organizations have partnered to develop a harmonized definition of cities and settlements that is based on people. It was recommended by the 2020 Statistical Commission, and now it's in the process of being implemented with over 40 countries, thanks to the in-country support we do together with UN Habitat and UNFPA. This methodology is not meant to replace national definitions, but rather to complement them. Once we have a common understanding of urban areas, we said we can populate those places, those boundaries, with indicators coming from other sources of data. In this case, we see information coming from the climate change service of Copernicus, showing the percentage of warm days in 2020 that exceeded 40%, and the size of the bubble is the share of people over 65 years of age. This is not directly a risk matrix or let's say highlighting problems, but it's a first way to look at integrated data for SDG 11 and SDG 3. Another example also included in UN Habitat World Cities report was looking at population in the urban centers living in buildings that are less than 2 floors high in coastal areas. We know that, of course, not all low buildings are vulnerable, but for sure there is a correlation there. And we see that in certain parts of the world, the color and the size of the bubble is much larger than in other areas. We do all that to support policies, to support countries in coming up with estimation of indicators for sustainable cities. We have examples from the cities, World Cities report with UN Habitat. In the past, we also contributed to the Global Assessment Report 2019. But we also look at integrating data coming from emissions. So we created maps of PM 2.5 concentration and premature mortality from PM 2.5. All this to say that it's open data, so everyone is invited to explore. Checking on the integration of the degree of urbanization with national data, as we have seen from Edgar, it was a great testimony. This methodology is most valuable when it is fed with national data. And we already saw a very good application to climate and hazard estimation. This is really then making those measures comparable, really leveraging on national data. At the same time, I want to stress the last point about data integration, about Earth observation. This slide is about introducing Earth observation indicators or Earth observation derived indicators into policies at the European level in the context of adaptation to climate change and so on, that also have a counterpart in legislation. So this is really the next step. So we monitor population exposure. We know technology can help us, but we really need also a legislation approach to back those commitments and efforts. The last point is about data integration. We mentioned we need integrated data, we need multi-thematic data, and this is an approach that we pursue in the Copernicus thematic hubs that are topics, so cross-sectoral topics. We have here the example of the coastal hub that really requires or is fed by data coming from different services. It has a contribution from flood, so emergency management. It has input from water quality monitoring, so the marine service. So this is the call to have broad topics that can be addressed by existing services or existing efforts really to address climate change at large. I leave you with this last slide with a paper that describes a bit our data and the Copernicus Emergency Management Service, where you can keep track of activities and situations. Thank you very much.
Thank you, Michel. You can just join us here on the podium. I think it was very insightful and quite fascinating presentation, presenting different aspects of data and how you are kind of layering one information with another, which is going to be very useful for the humanity. So thanks a lot for that. I don't know if Animesh Kumar, who's the head UNDRR office in Bonn, is available with us, and yes, he's there. So welcome, Animesh, for your presentation and to this symposium. We are very delighted to have you, and you have 15 minutes for your presentation, and then we will come back to you later with questions. Over to you now. Thank you.
Thank you very much, Chair. So while we wait for the slides to be on the screen. Great. So what I would do in my presentation is to provide a snapshot of how disaster data is being used for multiple purposes within the context of climate action. Just to introduce, UNDRR is the UN Office for Disaster Risk Reduction. We are the focal point for disaster risk reduction in the UN system. My office here in Bonn is responsible for the climate change and data portfolios of the organization. And this is what I will focus on in today's presentation. Next slide, please. So while we work as the focal point for DRR, one of our key areas of focus is the Sendai framework. Michel just mentioned about it in context of the Sendai framework for disaster risk reduction. We are the custodian of this framework, and in that capacity, we coordinate the implementation of disaster risk reduction and also monitor the implementation of Sendai framework. The Sendai framework is structured around 7 targets, which you can see on the screen, and has a total of 38 indicators. Each of these indicators have been developed through an intergovernmental multi-stakeholder process and have been endorsed by the UN General Assembly. So they are official in nature and the governments report against it. Out of the 7 targets, 4 of them are at the outcome level, which means that we measure the progress in disaster risk reduction against the reduction in disaster impact. So it includes human and economic impact of disasters. And then we have 3 targets that focus on the outputs, which is in the context of governance, financing, as well as early warning systems. Next slide, please. So as of now, we have done reasonably well in terms of collecting information from the governments. The governments, UN member states, voluntarily report on the progress on disaster risk reduction. A total of 167 countries so far have reported. Many of these targets and indicators are to be reported on an annual basis and some on a more continual basis. By reporting on Sendai Framework Monitor, countries also report on other intergovernmental processes including the SDGs. So UNDRR is also the custodian of selected targets of SDG 1, 11, and 13, 13 being on climate action. We also support other several intergovernmental mechanisms within climate change, ongoing as of now on the global goal on adaptation, something which I'll talk about a bit later. And also in the loss and damage space, the key focus of the monitoring effort is to ensure that there is adequate accountability and transparency in risk governance. And while countries officially report to us and we consolidate all this information, and subsequently the UN Secretary General reports back to the UN General Assembly on the progress of the world on disaster risk reduction, all the data that the countries report are publicly available and accessible. One of the things that we also do is that we acknowledge that not all the countries have the same capacity in terms of reporting, and hence we also provide support to countries in terms of collecting the data. One of the key things is a software system called Disaster Information Management System, or we call it Disinventar, which actually generated from Latin America. Colombia was the first country 30 years ago to have established it. Disinventar is currently present in more than 100 countries and has been iteratively established since 1994. These are very comprehensive data sources, collects information on disaster-related impact at sub-national levels in all these countries. In several countries, 3 tiers below the national level, so goes down to the localized scale of data collection. They are mostly collected by governments, so the governments have their own mechanism of collecting of the data, and UNDRR provides them with the necessary capacity support to do so. They collect the data based on harmonized methodologies and data standards, and can use all this data for overview of profiles and different other areas, and people can also download all the data for further analysis. By collecting the data on Disinventar, countries also report on Sendai Framework Monitor, so it is all interoperable. All this data again is owned by the governments, and a query-based system basically helps them develop different levels of analytics. Next slide, please. Now, while all this data have been in existence for quite some time now, we also acknowledge that the applications and use cases of data are diversifying. The risk profile of the world is itself changing thanks to climate change now, and hence we really need to understand the differentiated impact of climate change. Financing needs are increasing, and we need better evidence base for accessing finance, including in the context of loss and damage, DRR, and adaptation. To better inform development planning, more nuanced data, more granular data, sectoral data is needed, and more disaggregated information, including by sex, age, disability, and income is also very important. Early warning systems are advancing, but we are limited by the data, and so on. So there are a lot of use cases that are emerging, and we feel that our current data system is not fully adequate to meet all these use cases. Next slide, please. And hence, acknowledging this, we are now working on a new system. This has just been launched last month at the Global Platform on Disaster Risk Reduction in Geneva. We call it the Disaster Tracking System for hazardous events and loss and damage. Just as in the case with Disinventar, the new system will continue to be owned and operated by the governments, and UNDRR provides the necessary capacity, methodological and data standards, and an open source software to the governments for them to adopt it, adapt it, or customize it based on their respective needs. So this is very much based on partnerships. We really work with multiple organizations to ensure that countries have into their access multiple levels of support. This is the data model in terms of the system. You can see that the focus is not only on collection of data on hazardous event and loss and damage, which is we already have all the data there and will continue to be collected on an ongoing basis, but also we felt that unless we have the better data on vulnerability and exposure, we don't fill the whole circle in terms of disaster risk reduction. So the new system will have in itself the embedded population statistics, demographics, and so on that are so important to understand the context in which disasters take place. But they also provide much needed information on the vulnerability and exposure that are needed for risk management actions. We also realize that it is just not about rapid onset and extreme events that impact the population, but also the slow onset events, which has been a bit of a problem in terms of collection of data. So the new system will also provide the basis for collection of better data on slow onset events, as well as the non-economic losses, which are the intangible losses which people face, including cultural losses, loss of language, and so on. So the system will provide the necessary mechanism to collect slow onset event and non-economic losses data as well. Next slide. So while the focus continues to be more on hazards and vulnerability and exposure to complete the full circle, a lot of focus will also go into the sectors in terms of how health sector, the agriculture sector, water, and so on are embedded into the system. We also will have a lot of statistics on economic issues, socioeconomic data and poverty, and sectoral baseline analytics. All of this information will provide more customized analytics to inform multiple actions. I'm also very pleased to inform that while we are investing into better mechanisms for data collection, we are also investing into better data standards. In collaboration with the International Science Council, we have come up with data standards for hazards, hazard classification, which are now published. We are also working with the Statistical Commission of the UN to get a disaster-related statistics framework endorsed, which will be submitted to the Statistical Commission this year. That will provide a lot of basis for further work in the domain of disaster statistics, but also bring together the national statistics offices and the national disaster management offices, which remains a bit of a gap in several countries. Next slide, please. So thanks to all of these efforts that we have been taking, when we recently conducted a midterm review of the Sendai framework, we were able to follow a traffic light approach, as you can see on the screen, on which targets are doing well and which targets are not doing well, and in which targets we are actually decelerating or reversing in terms of our progress. I'm happy to inform that the global mortality has declined by half in the last 25 years. We are doing reasonably okay in terms of progress on early warning systems, and international cooperation and financing are also fairly okay, although much needs to be done. Almost all the countries have a disaster management institution, a focal point for that, as well as a DRR strategy, and hence progress goes well on governance. But when it comes to population affected by disasters or economic losses faced by systems, it's actually increasing. And this is something where more data is required to be able to contain the impact of population, of disasters. Next slide, please. Now I will move towards application on beyond the conventional disaster risk management. What are the other emerging use cases of the data we hold? One of the things is global goal on adaptation, which will be a key outcome at the Belém COP30 this year. UNDRR is one of the members in the expert group developing indicators for the global goal. We are already aware that there are 7 thematic targets and 4 process targets for the global goal. Considering that the key area of collaboration for the global goal on adaptation is in terms of increasing adaptive capacity, reducing vulnerability, and enhancing resilience. These 3 elements are also the goals of the Sendai framework. And hence there is a very high resonance and complementarity between the global goal on adaptation and the goal of the Sendai framework. So needless to say that many of the indicators that I mentioned earlier are currently in the mix for consideration of parties for the global goal indicators. At the same time, there are also means of implementation indicators within the Sendai framework that are of use for the global goal. It is expected that in the Belém COP, 100 indicators will be adopted, and to do so, we are meeting in Nairobi in 2 weeks' time as experts to discuss this further. Now, on this slide, I'm moving towards loss and damage. The areas concerning loss and damage have a very huge overlap when it comes to disaster risk reduction. And you can already see that the loss and damage actions listed there are also examples of disaster risk reduction. Now, the space on loss and damage has been evolving very positively from a time when it used to be only an agenda for negotiations, where from a time it used to be just a political agenda. Now it's a programmatic agenda. It's a tangible technical agenda. UNDRR, we host the Santiago network on loss and damage together with UNOPS, which is the first facility on loss and damage ever established under UNFCCC as a technical assistance arm. And then we are also very much collaborating with the Fund for Responding to Loss and Damage. Now, together with the Santiago network and the Fund for Responding to Loss and Damage, there are support available to the countries to able to access both technical assistance as well as financing. A total of more than $800 million have been pledged so far between these two mechanisms. But when we talk to countries, we often realize that the countries do not really have the right evidence base and data on loss and damage to be able to substantiate their loss and damage financing needs. And hence, the data that I've elaborated on so far have been found to be very useful in terms of countries to be able to justify and qualify their proposals. Last week, I was in Senegal conducting a workshop on Santiago Network. 34 African countries participated, and several of them have said that they want to use Santiago Network as the basis for getting better data capacity in their respective countries. My final slide is on early warnings for all. Next slide. We, together with WMO, co-lead the Early Warnings for All initiative. One of the key elements here is again to use the Sendai framework data together with other disaster impact data to inform early warning systems. The goal is that by 2027, every person on Earth will have access to early warnings. It's a very ambitious target. We're working towards it. Every year we do a lot of monitoring on a continual basis. You can already see some of the reports that are launched every COP. The next report will be launched in Belém. And one of the key things that we have been highlighting is that it is just not the early warning information, but it is very much embedded into the information on vulnerability and exposure, which strengthens and makes early warning systems more effective. We also know that early warnings work as a value chain, and this chain is only as strong as its weakest link. And this weakest link often happens to be at the last mile. And unless we strengthen the last mile outreach to the communities, early warning systems will not be effective. And hence data is very much required at the community level to make this more strong. I would end with that, with the last slide, and thanking you and looking forward to more discussion.
Thank you, Animesh. I was about to come to you telling that your time is about to be up. So thanks for completing on time. Yeah, very informative, and I think colleagues might have some questions later. But let me now move to the next part of this section, where we now have questions to the panelists. I don't know if Jack Amina is with us. Are you there, Jack? I don't think she's there, yeah? Okay, so while we just wait for her to be in, let me go to the next panelist. This is for Dr. Meghnad Dhimal, who is the Chief Nepal Health Research Council from Nepal Ministry of Health and Population. I have the question for you, which is what...
I have a presentation.
Okay, but I think I have a question for you.
Do you want the presentation?
I mean, you can respond because... Okay, so if you want to just do the presentation, I will just point out the time for you. I think you have about 8 minutes, yeah? So your question is, what are the practical steps governments and partners can take to embed disaggregated demographic data, including gender and age, into national early warning systems and disaster risk strategies? So maybe you can take about 4 minutes for this. Yeah, thank you.
Thank you so much. And I'll just share how we are integrating the population data for developing the early warning systems in the case of Nepal. And I'll just share the case example of DHIS2 platform in Nepal. So in Nepal, population data is being utilized for the several purposes, but for particular this talk, I'll just link how we are utilizing in the health sectors. So health management information system is one of the large and core routine-based web-based information system that has been put in place by the Ministry of Health and Populations. And if you see the history of health management information system, it was started in 1993, but last year we upgraded this HMS into the DHIS2 version 40. And this has the capability to host all the local and global data set, like the population data, environmental data, like the rainfall data, temperature data, and that we are now incorporating and developing the early warning systems. So I'll not go in detail of this, but the core business of routine health management information systems also take the consideration of data from like census, vital registration system, health sector information systems, and the population-based surveys. So to address the issue of climate change, as the Nepal is one of the most vulnerable country to adverse impact of climate change, we have the several policy response starting from 2007. So recently we submitted our NDC, National Determined Contribution Report, as well as we have the SNAP and NAP. And the main aim is for developing a prediction of climate sensitive disease as well as risks. So often we talk about the dengue, malaria, but if you see the maternal and child health, these are often neglected. So one of the aim of this DHIS2 platform is to utilize all the routine database that is disaggregated by the gender, disaggregated by the age, and also by ethnic groups. So that we utilize and we develop the early warning systems. So currently this DHIS2 climate and health project is funded from the Wellcome Trust in the 10 countries, and Nepal is selected one of them for a case of dengue. But after the pilot study, we come to the conclusion that we can scale up for other health outcomes. So what happened in the DHIS2 platform means there are the several F like CHAP, Climate Health Analytical Platforms. It can utilize all the health data from the routine HMS systems. We have the memorandum of understanding with the Department of Hydrology and Meteorology. We can take the meteorological data, local data, as well as we can collect all the global data set. There is a capability to extract all the global data like the ERA5 and others and population data. And based on that, we use the artificial intelligence and we develop the signals. So when we develop the signals means we should focus to the different groups, and many times we just focus to the certain groups, and that may fail the programs because we need to develop the synergy. So my hypothesis is that we need to follow the concept of life course approach. So based on that, there might be the several anticipatory action and early warning system focusing the different stage, like from fetus to pregnancy to older age. So we need to cover each stage for developing the early warning as well as for the anticipatory actions. So these are the few, like if we can, stop the early exposure to the fetus, then we can avoid the greater risks in the older population. For that means we need to focus to life course approach. So as a way forward, what could be done in a developing country like Nepal, like more than 80 countries are already using the DHIS2 for the collecting the routine data. And all the global data that is also presented earlier by the several speakers are also free of cost. So we can also import all this data in that platforms. So we can develop easily an early warning system, not only to infectious disease, but also for the maternal and child health related indicators. For that, we need to develop a life course climate resilient framework. Then we need to prioritize the equity focused adaptation. Similarly, we need to fill the gap for the mental health, non-communicable disease, and other thing, using also the life course approach. And we need to embed the climate health in policy and planning, including the capacity building programs. And finally, mobilizing the financing and partners is very important, because if the several partners come to a country and work separately, that may, paralyze the systems. But if they come together, and if you can develop the synergy, I think we can optimize the resources. So finally, one of the key components that is often missing, but very important, is the engaging the indigenous population community is very important, and we need to amplify their voices. Thank you. This is my brief presentation. If any question, definitely I will answer later. Thank you.
Thank you, Meghnad. Very succinct, and really before time you ended your presentation. Quite informative and very practical. Let me now go to, I don't know if Jack is online.
Yes, I'm sure.
Okay. Okay, great, wonderful. So welcome to this session. So I have a question for you. Let me just briefly introduce you. You are Jack Emina, Population Dynamics and Policy Advisor, UNFPA, UNFPA West and Central Africa region. So the question for you is, how can geospatial climate risk mapping be enhanced with population data to better inform anticipatory actions that prioritize access to essential health and protection services, particularly for women and girls? I guess you heard the question and understood it. Yeah. Over to you,
Thank
Jack.
you.
Thanks. Yeah.
Thank you for this opportunity. I'm sorry I did not have a good connection. So, to respond to your question, first, in West and Central Africa, we are already improving.
Just also to say, you have about 5 minutes to 6 minutes. Yeah.
Okay.
Thanks. Yeah. Sorry.
Okay. Thank you. So we are currently using georeference sensors to first locate both the population and also the services. So this is one thing we have been doing since the 2020 round of census. So in addition, we have the common operational data set on population statistic, the CODPS. So those that database allow to also to geolocate to map services and also the population using satellite imagery and also to detect the population movement. So this is the first two. And the third one is the use of hybrid sensors in the area where we cannot collect data directly. So we are using satellite imagery and also using some modeling to improve population localization and also to geomap the services. And then the last one is training on small area estimation. That will provide also some model and some granular data at the local level that allow us to link services and population indicator, including SRH indicators at the local level. Thank you.
Thank you, Jack. I think you were also ahead of time, so maybe time permitting, I will come back to you with second question. So now let me just move to Nabila. So Nabila, your question is, UNFPA Bangladesh seems to be the most significantly advanced on the work around anticipatory action. Can you share some of your key works and learnings from this?
Thank you, Raghu.
And you also have about 5 to 6 minutes.
Yes,
yeah, thank you.
Thank you, and I request you to supplement if you have to add anything. So first I want to say that Bangladesh has had the opportunity to implement a lot of activities, both on climate change and on the disaster risk reduction and management front, by virtue of what we are exposed to. And what we are going to talk about today is really been possible because of the work of the colleagues in our humanitarian team at the country office. So really thanks to them. So till now, we had heard about how data can be used for disaster risk reduction and early warning systems. And what I want to talk about is how to translate that into programs and what we have been doing. So in Bangladesh, we have been using the anticipatory action approach, which means using data to anticipate a disaster and to start preparing the community to respond to that. Two specific examples that we have from Bangladesh is we use weather data, wind speed data to identify if there is a risk of incoming cyclone, and also water level data to predict the risk of having floods. So using this data, there are pre-agreed thresholds which have been agreed across different expert groups within the country. They're also informed by global processes, and then together they form the framework of anticipatory action approach. That is a trigger, is the threshold met, and will there be a trigger for readiness, which is pre-specified, and also if there is going to be a trigger for action, which means that then the development community with the government needs to act. So that's the overall approach of using the data. The other segment, the other side of data here that becomes very important is the beneficiaries. So we now have the data to work, we know that a hazard is coming or not, but then what about the people that we need to reach? And for that, what happened is the UN organizations under the leadership of the Bangladesh Resident Coordinator's Office came together to form a common beneficiary database. So districts were identified which were particularly vulnerable. With the local government, certain indicators on SES were identified, and then a common beneficiary database was developed so that come a disaster, the people could be reached easily. So that was the other side of the data that was used. And what really we learned from this approach in Bangladesh, the anticipatory action was first piloted in 2015 by the Bangladesh Red Crescent Society. And since then, there has been multiple iterations, and we have, the program has really evolved. And what's really interesting is that this opportunity to work together as a coordinated ecosystem comprising of both the UN organizations, the governments, and the implementing partners at the local levels and the local communities has really provided the opportunity for effective interventions. Because I'm not sure how many of you are familiar with disaster response in low and middle income settings, in low resource settings. Systems do not work. They do not work in many of the cases in general, regular times, and during disasters they're disrupted so much that it's very, very difficult to do anything. So using this anticipatory action approach, we are able to have pre-specified budgets. Different UN organizations know they have a specific budget in case a trigger is reached. We have pre-specified work plans and interventions with implementing partners. They're trained and oriented beforehand about what activities need to be done. Like SRHR commodities are pre-positioned. So they are pre-positioned centrally in the national, like the capital, but also in the districts. When there is a readiness trigger, those commodities are sent so that they can be easily distributed if the trigger for activation is reached. So those are some of the things. It also allows us to work with the local communities to sensitize them better.
Nabila, you have 2 minutes just to, thanks.
Thank you. So the local communities are informed ahead of time. They are there is a trust building exercise that goes on with the local communities, the UN organizations and the implementing partners, which also makes them more comfortable to avail services. Another example in this situation is the case of pregnant women. So since we are an SRHR, like a team, when we work with the communities, we get the list of women who are pregnant and who are likely to deliver during that time period. So that really helps us work better with the local healthcare providers, either evacuating them beforehand or just making sure that they have the means to, transfer to facilities if the need arises. The other thing that has really worked with this setting is that and which is really effective, is the opportunity to integrate different types of interventions. So we have cash transfers, we have a distribution of specific kits, because in many times cash is not enough, supplies are not available. Like menstrual hygiene kits, we have dignity kits, and we have baby kits, which has essential supplies for a newborn baby. So we combine this with cash transfers and also with services.
So, Nabila, you have to wrap up.
Okay.
Yep.
Services both at the facility and in mobile clinics. So overall, this has worked really well for us so far. Thank you.
Thanks, Nabila, for that. I think, very pertinent and kind of, linking all the dots together to really show how data has been used in Bangladesh to do the anticipatory action. So now let me go to the last panelist, Jahanara Saeed. Do we have her with us? No? Oh, she's there. Yes, very, very nice to see you. Thanks for making the time. Let me just very quickly tell about you. You are Program Manager, Women's Environment and Development Organization, WEDO, Gender Plus Environment Data Alliance. Yeah. So once again, welcome. My question is, how can feminist data principles strengthen climate resilience frameworks? And what role can gender disaggregated data play in informing timely SRHR and GBV interventions during climate-related crises? Quite a mouthful. I guess you understood the question, and you are in a very good position to answer that. You have about 4 to 5 minutes, so over to you now. Thanks.
Great, no, thank you so much, and really appreciate being here and working with such esteemed colleagues. So, like you said, this is quite a meaty topic, so I think it's helpful to really maybe unpack what we mean by feminist data principles before we dig into how we could apply them in this particular context. So, as developed by Catherine D'Ignazio and Lauren Klein in their work on data feminism, when we're thinking about applying feminist data principles, we're thinking about examining and challenging power dynamics and structures. We're valuing multiple forms of knowledge and different perspectives. So this could include local and indigenous and experiential ways of knowing, thinking about us as people and our lived experiences and how that can inform policy planning and impact of particular issues. We're also rethinking and challenging binaries and hierarchies, which is something that is particularly important in the context of gender data. And then, of course, we're recognizing that context is really critical, that data isn't value neutral or objective, and we need to bear that in mind as we think about how we use that. So when we think about these principles, it really helps us challenge the accepted norms and ideas about data and data systems so that we can make them more community-driven and locally led. And this is something that the Gender and Environment Data Alliance really aims to do. So we're an alliance of over 100 organizations that work at the Gender Environment Data Nexus. And they really embody these principles in their work by challenging traditional data collection practices, making sure that we are including communities throughout the process, and experimenting with new and different methodologies. So what does that look like in this particular context? So when we're thinking about data in the context of SRHR and gender-based violent interventions in climate-induced crises, we need to think beyond just disaggregation. We need to take an intersectional and feminist approach to data collection and analysis. So this is including understanding how overlapping systems of oppression and identities impact how we experience the world. So this is looking at gender, age, disability status, migration, race, ethnicity, and bringing them all together to understand how certain crises or in moments are impacting people in different ways. And we also have to make sure that we're not just relying on official or traditional data systems, but really involving communities in these processes and integrating citizen data within our official statistics system. So an example that I really enjoy is one from Ghana. So the Ghana Statistical Service realized that there's a big gap in understanding gender-based violence data and launched an app called Let's Talk, where people can report anonymously on experiences either of themselves or people that they know of gender-based violence. So this includes collecting data about where it's happening, who is the perpetrator, when it happened, and things like that. So they launched this app and they found that they were collecting new information and data that they didn't have before. But they recognized that because of different access to smartphones and the internet, that they needed to adapt that to make sure that you could use phone calls and text-based services. They also then realized that they needed to make sure this was accessible in different languages so that you weren't excluding indigenous folks or other communities. And I think this is a really good example of how you can integrate citizen data within official statistics systems and also adapt the process to make sure that it's more inclusive of all of our communities. And I think another thing that we can think about in terms of how we're collecting this data that I think Nabila also touched upon is building that trust with communities, thinking about how we can make sure that they know what this data is, how we're collecting it and using it. So an example that I've seen in a lot of contexts is the use of or the employment of women and gender diverse enumerators when it comes to survey data collection. So this helps build trust with communities. They feel more comfortable sharing sensitive information. This is something that we saw happen in Gujarat in India, where female enumerators used phone call surveys to understand the gendered impacts of the COVID-19 pandemic on food security and household decision making. Again, another way in which we can rethink how we're collecting data. And I want to be cognizant of time, so I think another thing that we should be really thinking about is what happens next. We need to make sure that this isn't an extractive process with our communities and that they're involved at every stage of the process, including feedback loops to ensure that the data that's being collected is being used effectively and ethically. So this means investing in local data collection and analysis, but also thinking about the policies that we're developing and making sure that they're ethical and really center the bodily autonomy and rights of the communities that we're trying to serve and not misuse this data to push for top-down population control or fertility control narratives and policies, because that's really not what the goal should be in this situation. And then we should also recognize...
So, Janara, you need to just, wrap up. Yeah, thanks.
Sure. So I think the last thing I'll say is that we should involve communities, we should recognize them as agents of change, and be proactive in building sort of inclusive and resilient systems so that when crisis strikes, we have the information we need to respond accurately. So I'll stop there.
Thanks a lot. Really appreciate. I think once again, you have brought in all the dots together. I think, all the discussion that we have been doing, how all of that is kind of, being played out in reality on ground. So thanks for your contribution. Now, thank you all the panelists. Now, I would like to open the floor for questions. And maybe you can raise your hands and then we can take a few questions. Yeah. We have one online while you are deciding who's going to come in. Let me just read this question and maybe this is for Michelle. The question is, excellent presentation on Copernicus. I have a question with regard to putting additional layers related to climate infrastructure, in bracket health and education structures, wash infrastructures, energy, transport, etc. Do you have plans to help countries and those infrastructures to the population risk maps? It would help better tracking impact and eventually resilience under Sendai target C2. I think since I heard Sendai, so It could also be Animesh, but over to you, Michelle, if you would like to answer.
Then I can use the red one. Okay, thanks for the question. Yes, it's really important to be in the mindset of integrating data. Basically, nothing of what we have discussed this week can be addressed in a silo. So we started producing one type of data that was built up. Then immediately users said, we need to count people where they live. And so we added a population layer. Then we have this wealth of data coming from the Copernicus services. We have done some attempts to integrate ourselves, some of the data coming from the different services. We mentioned the Urban Center database. I invite you to have a look at this open and free data. It comes with documentation and some also visualizations, so you don't really need to go down to the shape files, to the nitty-gritty data. We have city profiles online, so you can really build your narrative just browsing a website. The second point I'd like to make is this is really the intersection between research and practice. So we don't ourselves have a capacity building program on integrating data, but really there are several platforms on the web built around Copernicus that really makes it very simple to integrate data. They have also pre-computed scripts or ways to integrate data. Last but not least, Earth Engine and really applications that facilitate the data integration. Probably an approach would be also to go through the thematic hubs of Copernicus, have a sort of research question or business need, and then really try to move the first step, and why not reach out to us. Thank you.
Thank you very much, Michelle. I will come back to you, Animesh, also if you have any comments, but let me seek some questions from the audience, if anyone has any question. Okay, so I don't see any questions. So, Animesh, are you there? Would you like to contribute to that question, or you're fine?
Yeah, maybe very briefly in terms of the work. So the reference was made for the climate infrastructure as well as the C2 indicator, and C2 for people who are not aware is the indicator of Sendai framework that measures agricultural losses. So on both these counts, we are working very closely with the partners. For example, on the agriculture losses, the lead agency is FAO. They are the ones actually who have developed a lot of methodologies, and we have worked very closely with them. I must say that unlike in other databases on disaster or losses and damages, UNDRR does not go and collect the data. The data are collected by the governments. And our responsibility is to ensure that they have the necessary capacity, technological support, data standards, and the right methodologies, so that there is a level of parity across different countries in terms of following the right standards. So things are evolving. We will be working further in terms of targeting and capturing agricultural losses better. A lot of work is ongoing in the context of the agriculture-related loss and damage report that FAO has been leading with our support, and it comes out every 2 years. So a lot of work is going into that as well. I also wanted to pick up a question that came on the chat box, which focuses on displacement. The question is more in terms of how are we tracking or capturing the information on displaced populations. There are some data which are available, like IOMs.
Animesh, you can just quickly wrap up here, yeah? And then I will just come back for the last quick sort of final comments, yeah? Okay, please, yes. Would you like to just conclude what you were saying?
I was just saying that displacement indicators are being developed and will be made part of the disaster tracking system that I was mentioning. This is an ongoing work in collaboration with the IOM and the IDMC.
Great. And thanks, Animesh. I think we are left with just 5 minutes, so let me just utilize this time by taking the final, just 30-second sort of wrap up or the final points from all the panelists. Let me start with you, Nabila, as you're sitting on the farthest end. Yes, you can.
Thank you, Raghu. Just to say that anticipatory action approach is also a form of adaptation, as we are seeing practically. So just to strengthen that as we move forward. Thank you.
Great, thanks. Yes, Meghnad, you, please.
Yeah. I think we need to adopt the system thinking approach, as well as we have to think from the life course approach. When we design the anticipatory actions, then that will be functional. And if you just think only a single dimension, that may not work in the real ground. Thank you.
Thank you very much. Michelle, you?
Yeah, I think I already had my chance.
Yes, yeah, so, okay, fine. Thanks a lot. Let me just go to Jack. Jack, are you there? Do you have any final wrap-up point?
Yeah, thank you. Yeah, I think we need an integrated multi-sectoral data system that will not only include data for climate change or for population, but to take into account even input from other sectors, output, and also the impact indicators. That is the second one. Is to say after that we need to analyze the data to look at really interconnection between different indicators so that we can well inform the policymakers and the community. Thank you.
Thank you very much. And Jahanara, your points, please.
Sure. No, I think that there are two things that we need to do. One, we need to be thinking about rebuilding our data systems so that they're more community involved and so that we have communities engaged at every stage of the data life cycle, and that recognizes that it's not just quantitative and qualitative data, but that there are other types of data to be included. But then also, as others have mentioned, breaking down silos between government agencies, data systems, data types, to make sure that we have a complete understanding of the unique vulnerabilities of our communities and their adaptive strategies.
So thanks, Jahanara. I think we are left with a few more minutes, and I have been just requested to take a few questions online. So I will read the question. I think the first one is for Meghnad, and please try to be very quick on that. In the event of mass displacement due to climate change crisis, how do you account for people on the move? During climate change crisis, compilation of both development and humanitarian actors is needed. Any good examples on how this works? Thanks.
Thank you so much for a very nice questions. Yes, we have an NDRM plan, National Disaster Risk Reduction Management Plan. So that look after all the disasters, including like forest fire, flood, landslide, everything. So climate change is the one aspect which triggers the existing, vulnerability, right? So we have an integrated plan now, right? So based on that, when there is a mass casualty or mass displacement, we have all the activities in plan, like how to manage the water supply, sanitation, how to manage the reproductive health kits, everything in place, right? So our security peoples, the role responsibility is clear, for the health professional, role and responsibility is clear, for the development partner, role and responsibility is clear. So based on that, we make a rapid response and we, address their needs urgently. Thank you.
Thank you. And this question was from Gamed, if I have pronounced that name correctly. If not, please excuse my not being able to pronounce it well. The next question is from Nicole. Recent data have shown that Georgetown city in Guyana will be destroyed by flooding by 2030. What are the best options for us as a nation given what the data has revealed? Should we move the city to a higher ground? So that's the question. I don't know who's going to take that one, but yeah. Anyone, I think, yeah. And even colleagues online, Jahanara. Animesh, do you think you can take that one? Do we have to move the city to the higher grounds? Is it even possible? Yeah. Okay, so maybe I can just comment on that one. Sure. Yeah. I think, taking the city to the higher ground may not be possible, but I think there definitely would be patches in the city, in the town, whereby we can have some sort of mechanisms of providing some sort of shelters. And then I think beyond the city, some interventions have to be looked into how we can prevent the factors or kind of, have some influence on the factors which are leading to it. Of course, not a very simple or not a very straightforward answer to that, but I think it is a multi-layered approach that requires to be taken in there. And this question, I think, is so very pertinent, really highlighting the sort of, frustrations that I think the global community is facing in the face of the climate change. Some of the very difficult questions that we all are facing, about which we don't know the answers, but we still have to find some answers. So I think, that would be my very quick response, given that time is very short and then no one was coming forward. So I just said that, but I'm not the final authority on that. There is one more question. I don't know if it's the screen, but I guess there are no more questions. Good, thanks a lot. I think it's always a very difficult task to moderate when you are being all the time, shown a piece of paper that, you have left with 1 minute, 2 minutes. But I really appreciate in this very short time that, people have really kind of provided their insight, all their life's work they have kind of, poured in here. And I guess that after this session, we all are going to be, enriched that much more to kind of carry on our work. So once again, thanks everyone for that. And I really enjoyed hosting this session. Thanks a lot. Yeah.
Muito bem, obrigado.
Very well, thank you very much, and to all the panelists of the 10th session for highlighting the invaluable role of the integrated data in our daily risk management. Well, going on to our next session called Climate-Induced Displacement, Migration and Conflict. This session will explore the critical links between climate impact, displacement, and conflict, drawing lessons from regions like the Horn of Africa and the Sahel with these crisis intersections. The session will prioritize scaling up support systems to ensure gender equality and to prevent and respond to SRHR and GBV challenges, particularly as climate-related displacement increases. It will also unpack the impact of climate change on youth, peace and climate security. The moderator of this session is going to be Elena Ateva, Director of Climate and Disaster Resilience for Asia, Eurasia, Middle East and Africa from America Cares. Madam Elena, please, the floor is yours.
Bom dia. Good afternoon, everyone. So my name is Elena Ateva, and I'm from AmeriCares. I know it's a little bit hard to pronounce. It's a play of words. We're a health-focused humanitarian and development organization. And this is why this topic is so near and dear to our hearts. It's really my privilege here today to moderate the session on climate-induced displacement, migration, and conflict. So while environmental changes and natural hazards have always been drivers of human movement, climate change is now intensifying those dynamics. And it's an unprecedented speed at which this is happening. It's making extreme weather events more frequent, more severe, eroding livelihoods and exacerbating existing vulnerabilities. Just to kind of paint the picture here, you all know, I'm sure, that the Intergovernmental Panel on Climate Change projects that more than 1 billion people globally could be exposed to coastal-specific climate hazards by 2050. So this is not very far off. And that potentially will drive tens of hundreds of millions of people to leave their home in the coming decades. The World Bank's Groundswell report, if you haven't seen that, it's excellent. I really recommend reading it. Projects that climate change could lead up to 216 million people across 6 world regions to move within their countries, again, by 2050. So the problem is enormous. And as humanitarians, this is what keeps us awake at night. We also know that climate change is a threat multiplier, which intensifies social, economic, and political tensions, particularly in fragile regions. For example, the Horn of Africa, and we're going to hear more about that, is faced with the triple nexus of climate-induced displacement, migration, and conflict. As vital resources like water, arable land become scarcer due to prolonged droughts, erratic rainfall, desertification, competition over these resources escalates into intercommunal conflicts. This in turn forces more people from their homes, driving both displacement and contributing to the longer-term migration, because of course people want to seek something better for themselves and their families. This creates a complex and often devastating cycle of environmental degradation, movement, and instability. And we know this is never good for women and girls. Existing inequalities only get magnified when we add crisis and displacement to the mix. Climate-related disruptions often result in the breakdown of social safety nets and access to essential services, leading to increased exposure to gender-based violence, including sexual exploitation, intimate partner violence, early enforced marriage, and trafficking. And these risks are especially acute during displacement and migration journeys, when protection systems are often weak or absent. Moreover, climate shocks severely undermine access to sexual and reproductive health services, including antenatal care, contraceptive access, menstrual hygiene management, safe childbirth. This disruption contributes to rising rates of unintended pregnancies, maternal neonatal mortality, and sexually transmitted infections, including HIV. Addressing the climate crisis, therefore, requires a gender-responsive approach that integrates gender-based violence prevention and response, as well as access to comprehensive sexual and reproductive health services as core components of humanitarian, climate adaptation, and resilience building strategies. So now this picture I know is quite overwhelming, so I just wanted to offer something that's a bit of a glimmer of hope. As many of you know, and we've talked about this a little bit, there were 2 major decisions from international tribunals just in the past few weeks. And they offer a little bit of hope. On July 3rd, the Inter-American Court of Human Rights issued an advisory opinion on climate change. And it's very comprehensive, and I welcome you to read it. But I want to point a few things that are really relevant to our conversation today. First, the court said that states are obligated to adopt measures to prevent forced migration and displacement, resulting directly and indirectly from disasters and other impacts of climate change. And then second, if that proves insufficient, if that prevention proves insufficient, the states are responsible for establishing a domestic framework that provides protection for internal and cross-border climate displacement. And this includes recognizing those displaced due to climate change as having refugee or other similar status, as well as guaranteeing the right to non-refoulement. So this did not exist before based on climate crisis aspects, right? And then to add to that, on July 23rd, the International Court of Justice further reaffirmed that states have a right to territorial sovereignty, even countries where the whole country will have to relocate, where their whole island will disappear underwater. These rights still exist, so this is very important, as well as the right to self-determination and continued statehood. So all of these are things that we can use in our advocacy, and those court decisions only live through us and what we do with them. So I really encourage everybody to read them and to make good use of them. And with that setting, I want to invite our first speaker, who is joining us online. So Dr. Michael Ebele is the Regional Humanitarian Advisor from the UNFPA SRO office. And He's a medical doctor and public health specialist with over 25 years in health systems, in development, conflict, climate emergencies, and disease outbreak contexts. So Dr. Ebele, it's over to you. Can we check that we can hear and see you? Oh, excellent.
Yeah, I hope everybody can see and hear me.
Yes, we can. Over to you.
Yeah, thanks, Elena. And I don't know if somebody over there can put up the presentation, or should I do it from this side? So thanks again for that wonderful introduction. And as Elena pointed out, climate change really is a crisis modifier, especially in areas in fragile areas that have a confluence of conflict, the impact of climate change, disease outbreaks, and socioeconomic challenges. So could you go to the next slide, please? Yeah, so just as a work background, I'll speak to, and this is nothing new. As many of you know, the Eastern Horn of Africa is a region that is home to socio-economic and political and climate-connected issues that have left quite a significant number of the population in need of humanitarian assistance. These have been confounded. The impact of the pandemic also compounded all these vulnerabilities. So what we do have is, a confluence of regional conflict, instability, that then drives people out of their homes as in search of solutions and safety from whatever hazards they're running away from. But then, as Elena pointed out before, the cycle continues, that as they're seeking solutions, then, we're again encountering them, contributing to the environmental degradation that then again comes back to bite them. So it is really an interconnected crisis of challenges. Move the next slide, please. So again, like I said, it's really a region. It's a region, so there are a lot of cross-border issues that come into play. There are tensions, there are insurgencies, there are political issues, there are conflicts that take on a kind of a regional cross-border nature. There are cross-border armed groups that take control of what goes on and make it difficult, for whatever interventions are being put in place. Extremist groups also impact on regional security and economic stability, which are supposed to solve some of the challenges brought about by climate change and conflict. Next slide, please. So what we have as a result is high levels of forced migration. And within these levels of migration, we find then that the region has a policy framework that does not ensure access to health care, protection, be it the wider protection, but most importantly, protection from gender-based violence and sexual exploitation. And it also creates contexts that become challenging in their own ways. If you look at the refugee camps and settlements in the region, they take on different formations. So these, lead to increased conflict of the resources with the people that are around the host communities. And then what we see from time to time are, short-term solutions, but we don't see clearly long-term solutions to this protracted displacement, because what we see in the Horn of Africa is people are forced out of their homes and, they live outside their homes for a prolonged period of time, where we really need to put in place durable solutions. You can move to the next slide. And that comes with challenges across the borders. Again, we do have the Eastern Horn of Africa has porous borders that make it difficult in regulating people who are fleeing for, reasons of conflict, but also there are people who are moving across borders for the wrong reasons. So the differentiation then becomes difficult, because you have illegal crossing, you have smuggling of people, smuggling networks that are very active in the region, Governance structures and corruption also limit, how much one can do to respond to the needs of the persons that are impacted, but also leave the persons much more vulnerable, when they are running away from a hazard, but they face again more challenges. And then of course, you have the impact of climate, or the impact of climate. You have prolonged drought that lead to reduced food production. There are pockets of famine in the region, people facing famine situations, and all these strains the available local, national, and international resources, and it's much more worse in the last few months that we have witnessed. You can move to the next slide. Again, there are trade and economic disputes that again come to fuel further more conflict, but also reduce the opportunities that are available for people impacted by climate. Disputes over natural resources. We all know the story about the disputes over the waters of the Nile. That is quite common in the region. So again, all those are issues that come to compound, to compound the vulnerability of the people impacted by climate. You can move to the next slide. So this situation requires regional collaboration, but again, because of political tensions, again, from time to time, we see that there's reduced regional cooperation, but also there are silent external influences, and shifting alliances that complicate the cross-border dynamics and make it difficult for long-term solutions to be put in place, because again, they're shifting alliances from time to time that impact on the continuity of negotiations or, long-term solution that will be put in place. And next slide. So like I said at the beginning, what we see is massive internal displacements. And now the massive internal displacements come with disrupted access to sexual and reproductive health services for the people on the move, but also because of the competition, even the people who are not on the move will experience this disruption, because again, conflict comes with extra caseloads, and in some of the contexts, if you look at, for example, the case in Uganda, where they have a more progressive refugee policy that puts more strain on the health systems and infrastructure that is in place, but also the severe weather events, the climate events, also themselves impact on the health systems and infrastructure. You can imagine during a drought, the lack of water in the health facility. What does that mean for a mother who has come to deliver at the health facility, or for a doctor or a midwife who is trying to perform a cesarean section? What does that mean for infection prevention and control? And of course, like earlier speakers spoke about, the increased vulnerabilities to trafficking, gender-based violence that comes with impacts of unplanned pregnancies, but also transmission of sexually transmitted infections and HIV. Next slide, please. So again, from the upstream level, we see that across the region, you see migrants and displaced people are not adequately addressed within the existing legislations, policies, and programming of the member states, and continue to be reliant, on external actors, humanitarian responders. And when you have a shift like we have had in terms of funding, like we've had recently, then that really comes to a sudden halt of services. But also, there are elements of underutilization, lack of awareness, poor quality, and a kind of differentiated treatments for people on the move, even within the services that are existing. Because we already in a situation where the health systems are already challenged, so you have fragile and weak health systems that then come up, are faced with this extra burden. Can move to the next slide. And most importantly, the age-specific sexual and reproductive health needs of children and adolescents are often overlooked because the thinking of most of the time is that children and adolescents probably they need nutrition or food or education. So that's often underrated. The lack of understanding of the gender dimensions of SRHR and GBV, and migration within the laws and policies, as I mentioned before. And even when you look at the migrant response plans and humanitarian response plans, they keep on talking about, the common things you hear about in humanitarian settings: food, access to shelter, access to water, and access to general health around communicable diseases. So some of the interventions that have been, partners have been trying to put in place together with UNFPA, governments and other partners. So again, I think we need to shift really to look at how do we look at the nexus of climate, displacement, and access to services. So we need to look at this, and like I mentioned before, we really need to look at the whole continuum, not just the humanitarian development, but also look at peace. Because without peace, these movements will continue, the displacements continue, which again further fuel climate vulnerabilities. So again, we need to look at that. So the International Conference of the Great Lakes Region Youth Forum, for example, is one of the platforms that has really tried to see how to bring together young people to see that we can promote peace. A deliberate looking at access to SRH services with localized models, so that we can have the people who interact with people on the move actually able to provide these services, so that they're able to provide them in a way that is acceptable, is cost-effective, but most importantly, accessible. And of course, the whole issues around commodities, because again, services without commodities become a challenge. So when health systems are strained, we really need to look at issues around supplies for people on the move. Next slide.
Dr. Ebele, can I ask you to wrap up?
Yes, I'm wrapping up,
okay,
yes.
Thank you.
So as I wrap up, again, as I mentioned, we really need to integrate these issues into the national and the regional plans, look at country preparedness to receive people on the move, as opposed to preparedness just for, internal displacement. And then also look at some of the challenges around the workforce. Again, we have workforce movements. Move to the next slide, please. I did mention that there are issues around trade and economic disparities and resources challenges. These are really at the bottom of these issues, but often we don't look at them. So they're very, very important for us to address some of the socioeconomic challenges, but also the systems resilience, so that whatever systems that we have in place are able to look at the needs of the people on the move. And then we really look at community resilience, community and individual resilience. Are people able to access self-care, mobile services, and virtual consultations, which may look like a dream, but I think these would be very practical solutions for people on the move. So as I conclude, as I mentioned earlier, it is really a confluence that we really need to look at, so that at whatever angle we are looking at all issues. We're looking at climate, displacement, but also conflict, because these are really interconnected. And there's no way we can do this within a single entity as nations. We really need to look at cross-border programs that will help us identify the most vulnerable among these groups, so that we really don't just look at leaving no one behind as a jargon, but put it into practice. And then there are good practices that we need to share across the nations. And collaboration is very, very important. Nobody can do that alone. So I'll stop there for now, and thank you very much.
Thank you so much, Dr. Ebele. You brought up so many important aspects that we're going to unpack further during the Q&A session, so I'm looking forward to that. Next, I would like to invite to the floor Dr. Honifile Mabuza, who is the Regional Migration Health Program Coordinator for the International Organization of Migration, Southern Africa. She oversees the SRHR and HIV Knows No Borders program. She's a medical doctor, an infectious disease epidemiologist with 23 years combined clinical and public health experience, focusing mainly on HIV, TB, COVID-19, and SRHR. Would you welcome to the floor? Thank you. And you have 10 minutes for your presentation.
Good afternoon, good morning, and good evening, wherever you are. Let me start by thanking the organizers of this symposium for inviting me to share on the work we have been doing as IOM around climate change, migration, and sexual and reproductive health and rights in the Southern Africa region. In the next 10 minutes, can I get the next slide, please? Go back, please. Back again. Yes, thank you. In the next 10 minutes, I will take you through a summary of findings and recommendations from an assessment conducted by IOM in 2024, exploring the nexus between climate change, migration, and SRHR in 6 Southern African countries. Next slide, please. Just as a way of background, Southern Africa, designated as a climate hotspot by the International Governmental Panel on Climate Change, faces severe vulnerabilities due to the increasing frequency and intensity of extreme weather events, with migration predominantly internal being an adaptation strategy to climate shocks. The region also has some of the worst global outcomes in SRHR, including high maternal mortality and unmet family planning needs, as well as high HIV prevalence, disproportionately affecting women and girls, and gender-based violence that is deeply intertwined with social norms, beliefs, and practices. The past few days, we've had speaker after speaker reference intersecting vulnerabilities of gender, race, age, disability in relation to climate change risks. Today, we add another layer, migration status, be it regular or irregular. Jahanara in the previous session also mentioned migration in her talk. Can we get the next slide, please? Just keep going, just keep going, keep going. So these data from the Internal Displacement Monitoring Center and National Disaster Management Center in South Africa demonstrate the sheer scale of displacement as a result of climate-related disasters in select countries in the SADC region between 2019 and 2023, with Mozambique being the hardest hit, as you can see from the numbers. Can I get the next slide, please? So moving straight to the objectives of the assessment, the main objective was to explore the nexus between climate change, migration, and SRHR in Southern Africa with 4 sub-objectives as follows. Assess national and subnational health systems readiness to support SRHR services following climate-related disasters. To identify SRHR HIV capacity needs in response to climate-related disasters. Document case studies showing climate change impacts and mitigation strategies on SRHR outcomes. And lastly, make recommendations to governments and partners on how to integrate SRHR HIV services into national disaster response plans. Can I get the next slide, please? So the assessment employed an exploratory mixed methods study design using observations, key informant interviews with senior government officials from the Ministries of Health, Climate and Environment, and National Disaster Management Agencies where those existed. Focus group discussions with nurses from PHC clinics, community-based organizations, community leaders, and project beneficiaries in the 6 Southern African countries as listed on the slide. The assessment was stratified by the 3 phases of migration, namely pre-migration or pre-departure phase, transit, and arrival phase, as each phase presents unique challenges and opportunities for the migrant or internally displaced person. Can we have the next slide, please? Next. So in this slide, we summarize findings and recommendations at pre-departure and transit phases. What the assessment found was that climate-related disasters almost always result in damaged infrastructure, including damaged clinics and roads, supply chain breakdowns, poor wash facilities, interruption in treatment due to ARVs being washed away in floods, as well as heightened gender-based violence, amongst others. And the assessment then recommended the establishment of national stockpile of critical medications like ARVs, medical supplies, and family planning commodities in response to emergencies following climate-related disasters. It also recommended the use of mobile health units to ensure SRHR HIV service provision during national disasters, and also provision of gender-sensitive support, private wash facilities, and MHPSS services, amongst others. During transit, overcrowding and insecure shelters in community halls or shelters where displaced people are usually housed following disasters were reported. These shelters often lack privacy, which may result in poor treatment adherence, especially among individuals on chronic medication like ARVs, which still carry a lot of stigma even today, leading to HIV transmission, treatment failure, and even emergence of drug resistance. Poor menstrual hygiene, under-resourced mobile clinics often lacking contraceptives and even emergency contraceptives, and of course heightened GBV were reported during the transit phase. Recommendations from the team were that improved shelter design with gender-sensitive layout needs to be considered, provision of SRHR commodities mobile clinics, as well as deployment of MHPSS and GBV response teams, and also establishment of safe reporting channels. Next slide, please. So now we just look at the arrival phase or integration phase, which is the last phase of migration. It was reported that overburdened host health facilities result in competition for scarce resources, bureaucratic delays, language barriers, over and above the already listed challenges faced during pre-departure and transit phases. The assessment recommended strengthened host health systems with clear policies that integrate migrants or internally displaced people, integration of SRHR into disaster risk reduction plans, fast-track and re-establishment of portable health records or digital technology, and provision of survivor-centered MHPSS and GBV responses, as well as establishment of legal assistance program. Next slide, please. So apologies, this is a rather busy slide, but really here the take-home message is that countries are at different stages in terms of development of national policies, including national disaster response plans, as you can see with the crosses and the ticks on the slide, with Mozambique being far behind in most areas assessed, yet you will recall from the earlier slide that it is the country that experiences frequent and worst climate-related disasters. A common thread across all 6 countries is that national policies are still highly fragmented, highly verticalized, with virtually no linkages or integration between programs. Next slide, please. Just keep going. I'm not going to read these. These were just real voices from the field, but in the interest of time, just keep going. I'll move to the next slide. Next slide, please. So in conclusion, National disaster response plans need to explicitly integrate SRHR, HIV, and GBV interventions. We need targeted interventions that must address unique challenges across all migration phases. Cross-sector collaboration between health, climate and environment, as well as disaster management agency is essential for impact. Stronger health systems improve preparedness and continuity of care during disasters. Enhanced community engagement empowers migrants and displaced populations. Expanded service access ensures that no one is left behind, especially the young people, sex workers, and GBV survivors. And lastly, protection and dignity first. Uphold human rights and resilience through compassionate systems. Next slide, please. So this is just a picture of the lady Amelia from Mozambique who gave birth on a mango tree back in 2019 during Cyclone Idai. And some colleagues will probably remember that in 2000, a similar situation happened in Mozambique where a lady gave birth on a tree. So the question today is why both stories highlight the strength and resilience of women in the face of extreme climate-related disasters. The births in trees also underscore the desperation and hardship faced by many women during these natural events. More than 20 years later, what have we learned from this experience? What are we doing to prevent this from happening again, especially in disaster-prone areas where such events are almost predictable? So now is the time to go beyond commitments and do some action. I thank you.
Thank you so much, Dr. Mabuza. Can I please invite you to take a seat? Such a moving story. I mean, giving birth on any given day is hard enough, but being able to do that from a tree should not have to happen to anyone. This, you also presented such a rich report, and I really appreciate the concrete recommendations that you shared at the end, and I'd love to talk more about this once we start the panel. But first, I'd like to invite our panel to the floor as well. First, joining us online, we have Noor El Arnaou, Director of the Global Health Institute at American University, Beirut, where she plays a key role in leading the Institute's digital health and e-health initiatives. May we check, Noor, that we can hear and see you? Excellent.
I can hear you. Can you hear me?
Yes, we can hear you very well. And then I would like to invite to the floor Mr. Ayobaru Gonugwene, who is a native and resident of northern Benin. He's a committed activist and director of the Barika Association, a feminist NGO advancing human rights, gender equality, sexual and reproductive health, and social cohesion amid insecurity and climate change. Please help me in welcoming Ayuba to the floor. Excellent. And also online, we have Mr. Apolinar Contreras Calisaya, who is a research monitoring and evaluation coordinator with the IPAS Development Foundation in Bolivia. Can we check, Apolinar, that we can see and hear you? Do we have Apolinar? Maybe we'll check in a few minutes, but let me start the conversation here with you, Noor. From a Middle East perspective, how do you see the impact of climate change on mobility and SRHR, especially during displacement? You have about 3 minutes to respond. Oh, and we can see Apolinar. Excellent. So over to you, Noor.
Yes, thank you for this question. So in the Middle East, those of you who don't really know the Middle East context, climate change, it acts as threat multipliers. Actually compounds vulnerabilities in already fragile settings. Many countries in the MENA region are actually in protracted crises, including my own country, Lebanon. There are intensifying droughts, heat waves, and water scarcity, especially in these conflict-affected areas. and these are actually triggering both sudden and slow onset of displacement and migration. So, for example, in 2024 alone, there are around 800,000 people in MENA who are newly displaced by disasters with specific like Yemen, Sudan, and other affected countries that are actually facing a challenging conflict. So to focus on healthcare specifically and particularly access to healthcare services, during displacement, access to these services, particularly sexually reproductive and maternal health services, is usually, disrupted. Women and girls, they face this disproportionate risk, including increased risk of gender-based violence, unwanted pregnancies, and even, complications during childbirth due to this limited access to sexual, reproductive, and maternal health services. And usually, these refugees and migrating populations, they are often, residing in overcrowded and under-sourced areas. So in many countries, they actually reside in rural areas that are already, under-resourced, that have suboptimal access to quality care services, be it in primary healthcare settings or tertiary care settings. So this actually, further expose these individuals who are continuously on the move to mental health stress, to increased risk of infectious diseases, to lack of access to essential health services, and so on. So there's, context. So like colleagues from Africa and other countries, the Middle East context is actually characterized by, as I said, ongoing conflict. We have a huge number of refugee populations. There are systemic gender inequities. So, for example, my country, Lebanon, is actually it has the highest number of refugees per capita worldwide. So, and most of these refugees, as I mentioned, they reside in underserved areas, and majority of these refugees are actually women and girls in childbearing age. So this makes the intersection of climate change, health, mobility, and particularly sexual reproductive maternal health particularly complicated and complex one. So addressing these interlinkages actually requires, recognizing that the problem exists and is exacerbated by different context-specific factors. And there's a core component that is the climate adaptation and humanitarian response, and how we need to think how these can be, sensitive when it comes to integration of social justice, of migration, of gender, of ethics, and so on.
Thank you so much, Noor. We'll move over next to Benin to hear from Ayuba, and I'd like you to tell us a little bit about the impact of climate change and displacement, on displacements and conflicts in your community, especially how it affects women and girls.
Thank you very much. Well, as I was mentioning, my name is Iba. I'm from Benin. I'm executive director of the Bahika Association, that is a community-based one that is in north of Benin, that currently knows a lot of tensions in regards to insecurity and also the advances of climate change. So, thinking of climate change, I have to say that it's a phenomenon that incites a lot of mobilization to the north of Benin, with other countries such as Nigeria that also have to mobilize themselves to north of Benin, looking for fields, for water, and also food for their cows, for example. These communities that come from these locations that are already facing climate changes from where they came initially, such as degradation of the soil, the lack of lands for their animals to graze. They face certain populational tensions as well with the residing population versus the one that is migrating. And at the same time, children and women are the ones that are most impacted by this, because these population that go to the north of Benin don't have a house or a residence where they can actually take refuge. And so they're going to be in tents where they have to sleep and are exposed to heat, to the cold, or in places where they don't have the minimum basic services. You don't have drinkable water. You have women that have to walk kilometers to find water every single day and are exposed to insecurity during that journey. Women that must use water that isn't actually drinkable and use it also for their to wash themselves. Women that as soon as that are giving birth and don't even have access to clean water or without any access to health centers. Children that also do not have access to education, and especially young girls that are used to be sent to be married because the family must survive, must also have means of surviving, where you must send the girl to get married to get revenue. So this entire situation to which these women are submitted in the north of Benin. The other aspect is that these populations come and face insecurities that were already there. Armed groups that have been starting to attack the north of Benin for a few years. We have a community called Pool, where people see that, well, this community is part of this armed group. And so the population that are often migrate there, they go to that community and they're seen like that, but they are not well received in the local community. They are discriminated, especially when women go to the market or the health center. They look at them badly. They say, oh, your husband's the one attacking us. You're the husband that is perpetrating violence against us. And they have trouble integrating them in the community and have access to the services. So these are the challenges that these women and these displaced communities face in the north of Benin, and that is obviously caused by climate change.
Thank you so much, Ayuba. I'd like to go then over to Apolinar online. Apolinar, you've done some very interesting work with indigenous communities in Bolivia, and I'd love to hear more and share with the audience about what transformations is climate change producing in the lives of Bolivia's indigenous communities. Over to you.
Gracias, muy buenas tardes. Sí, evidentemente.
Obrigado, boa tarde. Claro, no IMPAS fizemos uma investigação sobre o impacto da mudança climática na saúde sexual e reprodutiva das mulheres. Dessa vez focamos em comunidades indígenas. A Bolívia tem 4 lugares ecológicos onde as pessoas indígenas realmente, where indigenous people live, and where these communities want to explore how climate change is affecting their lives. I think that between the main findings in these 4 geographical areas, we found that the main problem when they faced climate change is lack of water in which affects their health and the hygiene. It also affects their harvest. It affects the food security in general. And this is a problem when we have strong rains, when we have droughts. The study also allows us to see the impacts of climate change. There's a whole causal chain that is very complex, ramifying itself into different areas of the family's lives. Their main issue for survival is the possibility of getting the economic resources to live. And that brings as a consequence migration, in many cases, forced migration, with the intention of just trying to survive, which leaves them in an unprotected situation where the girls have to take care of the house, of family members, and running risks, safety risks. In many cases, there are situations where they are harassed, where they are raped, and unwanted pregnancies. This study also allowed us to see that when they are facing climate crises in all their consequences, the issues of sexual and reproductive questions are not recognized as a problem because the survival issues take priority to these. We've also noticed and been able to see that in certain communities, especially the indigenous communities that live in the Bolivian Amazon, have started to use children, to marry children off as a means of getting economic resources, finding that adults with better economic capacity can sustain the girls and guarantee their survival. And so we have very early pregnancy and therefore risks of death for the girls that get pregnant. This is a critical situation that I think is really important to approach from the point of food security, but also in regards to contraceptive methods. These rural communities these communities are rural, and makes that these subjects can very often be taboo, and that means that they don't want the modern contraceptive methods or more and therefore want more traditional or better accepted ones. So I think that this puts these women and children even more at risk. And these houses that they have are also more at risk to floods and fires, and they are often at risk of being in areas that suffer these hazards, puts these children and women at risk even more so with the difficulty in reaching these services.
What questions are there in the room? I have more questions for our panel and for our presenters, but I'd love to see if you're already starting to think about. We have questions online? I don't see any for session 11, right? Yeah, not yet. Okay. Do we have other questions online on Zoom? Not. Okay. All right. So I'd love to invite the audience here in the room to think about questions. Raise your hand. And while we were thinking, I have two questions to pose to all of the panelists. We talked a lot about people on the move, and that was a question from the previous session as well. And this is a serious trend that we're all facing. It used to be that people would move from one location to another and stay put, and that's no longer the case because resources are scarce, life is hard, and so people have to keep moving to find better conditions for themselves and their families. However, the way we provide health services has not caught up. We usually provide services in one specific place. For so many aspects, especially SRHR aspects of health services, continuity of care is really important. So having that connection and trust built with your provider, for example, if you're receiving antenatal care or HIV/AIDS services, but also that provider knowing you and your situation and what's best for you. So what would be your recommendation? What do you see maybe as an opportunity? I want us to be creative here and really think about what are some practical solutions that we can implement to meet those needs, because this is obviously a trend that will only increase. So maybe let me start with Dr. Michael online, if you don't mind me calling on you first.
Yeah, not a problem. So indeed, you're right that the way people move in search of solutions or away from danger has changed. We have people moving from one location, moving to secondary movements of people. So I think there's two things that we need to look into here. One is what is the service environment within the places within which people are moving. That's why we talked about the cross-border modality of delivery of services. So when people move from one administrative zone to another, one, is there recognition of the service that they have already received? And then two, how related is the service they have received to what is available in the next location? If somebody talks about antiretroviral services, for example, are we sure that the regimens across the next destination are the same? And if not, then what do we do to make sure that there is that uniformity of service, continuity of services? The other one would be looking at providers, because many times providers are equally on the move. Midwives are on the move. Doctors are on the move. We have seen that in the crisis, the Sudan crisis is a good example, where you have a massive amount of healthcare workers also on the move with the population. So how do we empower those that are already cognizant, that are already familiar with the needs of the people that they are moving with, to be able to ensure that there's continuity of that service? So those are discussions that we really need to have, such that even when people cross over to another administrative area, that that they're able to access what they need for them to provide the services. And then lastly, we also need to look at the characteristics of the people. For example, in the Eastern Horn of Africa, we have nomadic people that move in search of water and pasture for their animals. Very often, they are able to look for solutions for healthcare for their animals. But then, how do we ensure that we, for example, look at the one health approach that looks at health for all, health for people, health for their livestock, and then so that we're able to share the supply chain solutions. We're able to share, the access negotiations. So those are some of the ways we could think around how we address the challenges around continuity of SRHR services. I'll stop there. Thank you.
Excellent. No, thank you. You brought so many important points, but especially around the providers who, again, part of the community also are moving, and so our support also needs to change and adapt to that. Moving over to you, Dr. Cornelius, the same question.
Okay, thank you for the question. I think Dr. Michael has covered some of the thinking around this issue, but what I can add is that it's not just people being on the move, but also what tends to compound the situation is that these folks tend to lack even documentation. And so most times they are not documented, they are irregular or undocumented migrants, and therefore it makes it extremely difficult for them to access services, especially as we move to digitization, where you are expected to produce, your identity document before you can be assisted. But also, when what we've seen is that when people move, they tend to do what we call silent transfers. They don't usually tell their service provider that they'll be moving, because oftentimes it's sudden and it's really a matter of survival. And so they won't get the proper transfer letters or maybe referral forms that will assist them when they get to the destination or the host clinic. And so what we've started doing in Southern Africa is working around what we call differentiated service delivery models, where we meet the people right at the points where they are. And when it comes to ARVs, we also do what we call multi-month scripting, where the patient will tell the service provider that I'll be embarking on a trip, maybe from Zimbabwe going to South Africa, and they're on ARVs, and they can easily get a 6-month supply to cover them during, their journey. And so by doing that, we ensure that they do not interrupt treatment as they move across borders. But also, Dr. Michael spoke to the issue of standardized regimens across the region. I think fortunately for Southern Africa, there's a bit of, harmonization of the ART regimens, but we do see in some cases where the trade names are slightly different and patients will insist, this is not what I'm taking, but I think it's a serious challenge, and I don't think there's a cookie cutter approach in terms of addressing this, but we are already trialing a few things and we are seeing results. Thanks.
No, thank you. All of those examples sound really interesting. And I'd love if you can share more, perhaps after the session. I'm wondering, Noor, from your perspective, you're working in Lebanon, if there are any also localized solutions that you're seeing, and you mentioned, that your country also has a lot of experience, is a huge host. So I'm just wondering if you have anything else to share on those people on the move and how we provide health services, how do we ensure continuity of care?
Sure, thank you for this question. So I'm going to address this more at the macro level. So I think where we stand now in the MENA region is that we are beginning to understand the interlinkages, between climate change, migration, and social justice. But the current responses, they remain to address specific So the complementarity between or among the different stakeholders that are being involved, and there's definitely insufficient integration of not only sexual and reproductive maternal health services and rights, but also health in general within the climate and displacement framework. So policies, they rarely reflect the lived experiences of those people that are on the move and that we're talking about, particularly in the MENA region, and especially women, girls, adolescents, and people with disability. And the global frameworks that actually exist and that colleagues in previous sessions spoke about, including the Sendai framework, the UNFCCC and related agreements, the UN Declaration on Climate Change and Health, they all, touch upon health and integrate health, and many of these frameworks and agreements and others actually include mobility and migration. But, realistically speaking, how many of us are actually integrating this into our day-to-day programmatic operations or programs development? So this is the real question here for us in the MENA region. And perhaps to also colleagues and other regions as well. However, we should also, recognize that multiple agencies in MENA are actually intensifying their effort to address this nexus, sometimes in silos and sometimes in collaboration with each others, but there are actually, actors regionally and globally that are working on this, such as, for our partners, the International Office of Migration, WHO, UNFPA, academic entities, and other organizations as well. They are issuing different guides, documents, toolkits. They are actively involved in conducting research studies. And this actually, is pretty important because in MENA, we sometimes don't even have data about this subject. So, for example, yesterday I was just in a meeting that presented findings from a basic learning needs assessment among health workers related to how much they knew about the effect of climate change on health. And these health workers primarily, they were practitioners in primary healthcare settings, providing services to refugees and migrants. And it actually highlighted that there's a huge need for capacity building, training for these health workers. So even funding agencies that are providing support on this nexus, this topic. So I think, in my opinion, the number one recommendation is that there should be more coordination at the regional and also at the global level in terms of the effort that is being done. So and there should be some sort of complementarity between who is working on generating evidence, who's working on assessing the health. So we need evidence-based planning that reflects actually mobility trends, the health needs of these populations, the gender-specific risks, and so on. So this is one approach, and then an adoption of a systematic and intersectional approach for programming. So, for example, at the Global Health Institute, the institute I'm representing at AB is, we do have a CLI Health program that's actually a model that centers equity and social justice and, understanding this whole nexus of climate change, health, and mobility. But this should be more research efforts and programmatic efforts, and there should be more coordination at the level of different actors.
Yeah, thank you so much, Noor. So important. This is not an issue that will be solved by a single entity, but the collaboration is so much needed. I just want to check to see if there are any questions in the room before we continue with the panel. I'm trying to see. I see one question over there. Thank you.
Yeah, just a comment. I know sometimes when we talk about migration, we always talk about, Nicole Hendrickson. When we have the conversation about migration, we always talk about the fact that sometimes the countries that they go to seem burdened by having them. But also, what about the pluses that happen when persons come to one country? But also wanted to highlight an example in terms of what the doctor talked about. We had a case in detention where the person was given ARVs and then they left. So sometimes when we think we're doing something good in terms of seeking to reduce their viral load and giving them ARVs, there's a possibility of then becoming drug resistant if the person doesn't follow up. So just things like that for us to be aware of sometimes when we think we're seeking to help, to ensure that we really think about the person and not just wanting to help.
Thank you, Nicole. I think there were two things, there are two comments, right? The positive aspects of migration, but that continuity of care, this is really what scares me, absolutely. All right, let's give the word to Ayuba, if you'd like to answer the question on people on the move.
Thank you very much. Regarding me and my country, Benin, and this subject, I would like to inform you that we are within the project of adaptation in the country, and we have seen the reality of displacement, which are already challenged by what is related to climate change, and they come to us and we can send them back. So we have to consider these people's needs, and they need to adapt to our health services. Another thing I would like to add, which is necessary to educate the population and work towards helping them to receive these people that come from other places so they can receive health treatments to avoid the care. So we need to perform a census to know where this person will be. We are going to offer a health service, and we will try to improve complexity informing to the health personnel to support this person in an adequate manner, giving them the necessary health services so we can help them adequately. And obviously, we guide health personnel to perform the necessary care. So we need to avoid insecurity. So we are going to make sure that the person that is displacing themselves to have assured adequate health services. Another important aspect is to inform our communities so we can supply their information, as when they come out of nowhere, what was foreseen for this person that is coming to us. This is our role, to inform those who are coming to the health services and also to those who displace themselves, that they can benefit from this or that service.
Much, and these are so practical aspects of things that we can do right away, right? We don't have to wait. Apolinar, if you're still with us online, I'd love to pose the same question to you. We're talking about people on the move and how we ensure continuity of services, especially SRHR.
Thank you very much. Migration in Bolivia in the past few years is, given the economic crises that the country is facing apart from climate change, that generates tension on border areas. And usually in these regions, it is very dynamic due to economic conflicts. And this is also giving space so that these border areas are having an increase in human trafficking, of child prostitution, which is not being assessed or measured. There are no specific actions in this. The indigenous communities are migrating, and in its conception, they do not understand climate change. They see it as a rupture between the land and community. However, right now we have no actions, direct actions from the state to try to attenuate such migration. However, at the moment we have tasks, emergency tasks that are being performed, that is with the distribution of water, medication, food, and also one thing that is not being told, which is taking care of the mental health of children, young girls, and women that will face such issues that arise from climate change. We are aligned with our communities' cultures, and it is dramatic to see that in 36 indigenous communities that are registered in Bolivia, some have many issues given the migration processes or due to the lack of food and resources, and they are disappearing as the situation is truly dire. So to create policies, economic policies connected to development should be guided towards uniting communities with their land. This could therefore strengthen the development of communities and start to work on sexual health without interrupting their culture. And I believe that this is really important. This is an important theme in Bolivia. We are right now in a political transition moment, but are talking about the standpoint of the state and international collaboration. This is a critical moment, an important moment with social responsibility.
And unfortunately, we're at time, so I'll ask you, and starting with you, Apolinar, to just give us a 30-second takeaway. What would you like for people to remember from this conversation? Over to you, Apolinar.
Human beings and women and those united to the land and climate change are separating us from our personal areas, and we need to be aware of that and strengthen our connection with nature.
So much, and thank you for sticking to the time. All right, over to you, Ayuba. I'll go in the opposite direction this time around. Reflection. What would you like people to remember?
Thank you very much. I would like to tell you that today the needs for adaptation need for us to pay attention to the issue of gender integrity. We need to have good integral health services to improve the life of those who are suffering due to tension, climate, and also populations that need resilience. Thank you so much.
So much. And over to you, Noor, online. Just 30 seconds summary.
So as a take-home message, I think from my end is that the approach to address the nexus of climate change, health, and migration is not a one-size-fits-all. It has to be tailored and very specific to each context that we are working in to better understand this and address it.
Thank you so much. Dr. Fule?
Thank you. I think for me, it's really understanding that climate-related events are no longer a question of if, but they're a question of when. And we've seen that when they strike, the frequency is going higher and the severity as well. So it's very important for us to start looking at how we can integrate SRHR into the disaster response plans across the migration continuum, starting from pre-migration, transit phase, up to integration phase. Thank you.
Excellent, thank you. And over to you, Michael, online. What's your 30-second takeaway message?
Yeah, thanks. I'd like to pick up from the positive aspects of migration and look at it as an opportunity to identify the faults within the health systems and fix those and make the systems much more resilient to be able to take up extra needs when they arise. And then that also sometimes the solutions lie within the people that are on the move themselves, because as we said, nurses, doctors, midwives are part of the communities that move. Thank you.
Thank you so much, Michael. And I want to end with your message of peace, the way you started. I really like that. And how we build peace at all the different levels where we operate. I think this is something that we all can contribute to, contribute to a world that we want to see, not the one that exists currently. Thank you so much, everybody. Please join me in thanking our wonderful panel for the excellent discussion today. And if you would indulge me for just 1 minute, I'm not going to be here today, tomorrow, but I want to take a minute to thank our interpreters, because that job is hard, and I swear I think that they know what we're going to say before we say it. So please join me in thanking our interpreters for the hard work they did.
Ok, muito obrigado.
Thank you very much, Elena, and the panelists of the 11th session for this deep discussion on displacement and conflicts induced by displacement. These are a powerful appeal to action, a call to action. Now we are going to have a lunch break, and we will be back at 2:30. Please, let's have an excellent lunch, and we'll receive you back for the last panel of the day.
Pedimos a todos, por gentileza, que tomem seus assentos. Aqueles que, porventura, ainda estejam do lado externo do auditório, pedimos também que entrem e se acomodem.
In a few minutes, we are going to start our activities.
Muito bem, bem-vindos de volta, pessoal. Nossa última sessão temática.
Welcome back to our last thematic session with the title Environment Indigenous People-Based Solutions. This session will explore solutions based on nature that effectively support adaptation and building resilience for women and girls, specifically integrating health and reproductive rights and increasing protection against gender-based violence and harmful practices. We will unveil the different opportunities presented by these solutions, including our Alice Cafaro that will guide us to the call to action.
Saudamos.
Well, we then salute everyone here, those who are following us through YouTube.
Muito bem, retificando aqui as informações.
Rectifying the information here. For this last panel, we invite the moderator of this session, Madam Mamahila Matamami from the South African Development Commission Parliamentary Forum. A round of applause for her. Welcome. The floor is yours.
Thank you for having me. Thank you for having me and good afternoon. I'm going to briefly give a brief summary of this session. This session will explore the disproportionate impacts of climate change on indigenous populations shaped by colonial legacies and ongoing social, political, and economic marginalization. Despite contributing minimally to climate change, indigenous communities, often custodians of biodiverse lands, face heightened vulnerabilities, including food insecurity, displacement, and limited access to sexual reproductive health and rights services, especially after climate-induced disasters. The discussion will highlight the need for holistic nature-based solutions that integrate SRHR, protection from gender-based violence, GBV, and respect for cultural practices. Case studies such as UNFPA Climate Empower Initiative and Peru NUA Senchu Project illustrate how culturally grounded interventions can strengthen community resilience. Additionally, the session will examine barriers to indigenous peoples' meaningful participation in global climate policy, underscoring the importance of equitable representation, traditional knowledge, and co-created solutions to ensure climate responses are inclusive, just, and effective. And the objective of our session today will explore nature-based solutions that effectively support adaptation resilience building for women and girls, specifically by integrating SRHR and enhancing protection against GBV and harmful practices. This session will unpack the diverse opportunities presented by these solutions, including the vital role of indigenous groups in effective adaptation and resilience measures, knowledge management, and avoiding maladaptation. Furthermore, it will delve into the concept of ecosystem-based adaptation for food security assembly. Thank you very much. Without any further ado, I will go straight to our first presenter, who is Shobna Sori, a researcher from the University of Witwatersrand. Kindly join me in welcoming Shobna to the stage. Thank you. Sorry, Shobna, you have 10 minutes.
Yeah, thank you. Let's see if this works better for me today. Good afternoon, everyone. Can we start the slide presentation, please? Okay. Thank you so much for being here. Today I'm going to talk to you about an experience that we had recently in one of our projects in developing heat adaptation interventions for pregnant women and their infants, and just giving you an African perspective on this. So as a bit of a background, we know now that temperatures in southern Africa are rising twice as fast as the global average, and this poses significant health risks for maternal and newborn health. In particular, Southern Africa faces additional challenges due to poverty, inadequate infrastructure, ecosystem degradation, and this again makes vulnerable groups such as pregnant women in subsistence farming communities as well as urban informal settlements much less able to adapt. Social norms and gender inequalities, as we've heard, further constrain women's agency and ability to adapt to these changes. And lastly, research on these heat-related harms in pregnancy, as I said on Monday, is limited, especially around interventions to actually reduce these harms. And so the study that we did is called HAPPY. It stands for Heat Adaptations for Pregnant Women and Infants. The aim of the study was to co-produce multi-level, multi-component interventions to reduce heat impacts on pregnant women and infants, and in diverse contexts as well. The setting I'm going to talk about today is the South African setting, which is low-income urban informal dwellings in a district in South Africa. The first part of the study was very formative, so we did a lot of qualitative work. We enrolled 26 pregnant women between March and May 2024. We did thermal monitoring. We had serial IDIs during their pregnancy and in the early postpartum period. We conducted key informant interviews with community leaders, and we also had some ethnographic observations. Don't stress, I'm not going to give you the results from all of that. I'll be here all day. So this is a picture that you are, I'll change it on my screen, that you are now familiar with. This is the informal settlement that we work in. The one on the left is much more densely packed, as you can see. And I think while looking at this picture, just think about nature-based solutions in this space and how you could potentially put nature-based solutions in this space. So again, this area is very characterized, as you can see, by overcrowding. The households are literally makeshift structures. They are not very stable. They don't have much in terms of shading. It's made of very cheap construction materials, mainly metal. And these homes have a very low thermal mass, which really means that it heats up quickly, it radiates heat quickly, It does cool down quickly at night, but we'll see whether that actually happens. This area has no piped water. There is no electricity in this area. Obviously, no road infrastructure to get services to people. Very few trees, except for those on the far end, and no green spaces at all. And this is really the epitome of unsustainable urban development that we heard about this morning. So what we did is we wanted to capture heat exposure that pregnant women are exposed to. And we didn't just want weather station data, because weather stations are quite far from where women actually live. We wanted to capture their microclimate exposure to heat. So we had household temperature exposure measurements using thermal monitoring in the participants' bedrooms. We had outdoor heat exposure in the form of a mini weather station at a nearby health facility. And because pregnant women spend a fair amount of time in health facilities, we also monitored temperatures in antenatal care waiting rooms, postnatal wards, as well as the labor ward. And this is a graph that I gave you a sneak peek into on Monday. Again, just to highlight that when we look at daily maximum heat exposure, and this is apparent temperature, it takes into account both the heat and the humidity. We see that the highest exposure is seen inside women's households compared to outdoors. And this was a heat wave that we experienced, and maybe just to give you a little bit extra background, the time that we did this study was not actually in the middle of summer. This was actually towards the end of summer, almost moving into autumn. So in the midst of summer, we'll see much higher temperatures. So at this point, there were homes that reached almost 47 degrees Celsius at around midday. Again, to note that the nocturnal temperatures were also quite high. So as much as we say that these homes have a low thermal mass, they are not dissipating heat as much as we'd like. And so we asked women, how do you feel about heat? What was their physical and their psychological well-being in relation to being exposed to heat? In summary, they felt the heat stress on their body. They reported increased fatigue and discomfort. They were irritable and stressed, and they reported sleep disruption as well. One woman said, her husband was there. He said, you're feeling hot, go and sleep on the floor. He was really trying his best to fan her, and she just kept shouting at him. She says, I don't know why I was shouting at him. Maybe I was crazy. But that's what heat does, right? When we're very hot, we get irritable, we get cranky. And so when you're pregnant, you're extra cranky. And women reported not sleeping, waking up at odd hours, doing work at odd hours, and by 6 a.m. they're exhausted again. When it came to their social interactions, pregnant women didn't want to have any social interaction. They don't want anyone to come and disturb them because it's very hot. She says, I just prefer being on my own, in my own comfort, because it's hot. And one of the adaptation measures that they used was that they actually undress. They go down to the bare minimum just so that they can cool down. So in that space, you can't have social interactions. You don't want friends to come over. You don't want to meet with people. And then we also noticed that they had very little agency to modify their built environment. A lot of the women in this neighborhood have rental properties. They're a migrant population, and that hinders their ability to make any changes. So it's all very well and good to say, oh, put a window here, it will help with ventilation. But actually they can't. It's not their home. And then the other thing was theft. South Africa is known for having relatively high crime rates, and so women said that if we have more windows, it just provides more access points. So you can't leave your windows open, you can't have more windows, and you don't leave the doors open either. When we asked about the impact of heat on infants, they said that, they avoid breastfeeding. The infants are irritable when they are breastfeeding. Sometimes it just feels like there's nothing that can relieve them. One of the things that's quite strong in the African culture is swaddling of babies. And it doesn't matter how hot it is, women still swaddle their babies. And you can see here a woman said, I would open the blanket and find him sweating. So the first question is, why was there a blanket? But anyway, this is what women do. And you know, nothing helps the baby, nothing relieves the baby, even breastfeeding doesn't help the baby. And so when we ask community leaders, what do you think? What are the issues in your community? The things that they pointed out was a lack of trees, limited shading, limited effectiveness of windows, and that's mainly because there's a rubbish dump close by. So even if you have windows, if you open the windows, it lets in the flies, it lets in a bad smell, so that's not helpful either. Poor ventilation and airflow, again, because the windows can't be opened, the doors can't be opened. Insufficient water supply and electricity, as I said. And so in summary, the key findings from our formative research was that during the study period, we had the highest heat exposure in women's homes compared to outdoor exposure. The heat that women are exposed to during heat waves far exceeds safe thresholds. And when we look at outdoor exposure, it actually significantly underestimates the true heat that women experience. 1 minute. Okay, let me move on. And so we took all of this information and we went into a co-design workshop with pregnant women and a whole lot of other people. We had more than 100 people that were involved in it, and women engaged in a community mapping exercise where they just outlined what their community looked like. Where were the places that were hot? Where would they get water? Where would they get shade, if any? How far they had to walk to get to a taxi in order to go to a health facility. And that's where a lot of information came to us in terms of what it is that's actually feasible to implement for adaptation. You know, as scientists, we often go in and we think we have the answers, but the women really surprised us with what they came up with as well. And so a lot of the things that we thought would work actually cannot work. And so the interventions that we are going to be testing come the next hot season is using little house handheld fans, a desktop air conditioner. We're going to try heat reflective paint on the roofs. We're going to see how women feel about these umbrella hats. And because they don't have electricity, we've got these little solar panels that will be used to just give them the power. Time is up. At the community and facility level, we will be planting trees. We cannot plant trees in women's backyards. There's just no space, so we're going to be doing it at the community level. We were told that we need to be careful about where we do this, because come winter, the wood is more valuable for heating. And so trees will be cut down. Yeah, I think we can end there. We're going into stage 2 at the end of the year. Thank you.
Thank you so much. Yes, we can clap hands for Sabrina. Thank you so much for such insightful information of what women are going through in South Africa in the face of climate change. Without any waste of time, we are going to go straight to our second presenter. In fact, we have 2 presenters online who are joining us online. We have Caroline, who is the project coordinator, Natural Resource Management and Climate Change. Caroline, you have 10 minutes to do your presentation, and we will also have Gabriel Smiles. Oh my God, sorry if I'm butchering your names where I'm seated right here. But our second presenter also will be Gabriel, Program Director for Sounds Right Museum for the UN, and he will be having 6 minutes. So, Caroline, you have the stage. Please continue with us if you are there.
Thank you so much. My name is Caroline Kulgat. I'm the project coordinator working with COSME project, that is Conservation and Sustainable Management of Coastal and Marine Ecosystem under Plan International. I'm happy to be part of this symposium, and the title of my presentation is Empowering Kayachonyi Community for Gender Responsive Culturally Rooted Forest Conservation. So I just want to give you a brief of the COSME project, which is implementing this project. And I've said that COSME is abbreviation, which means conservation and sustainable management of the coastal and marine ecosystem. And we are working in Kenya, the coastal part of Kenya, in Kwale and Kilifi, and 65 communities, that is the terrestrial communities and also marine communities. We also work in Tanzania, implemented under Jane Goodall Institute, working with 45 communities. So the duration of the project is March 2023 to December 2026. And the donor is Global Affairs Canada. So we have partners who are working with us, that is the Cascadia, and we are also working with Jane Goodall Institute and working with the government institutions, that is national and county government, and working with bodies that conserve forest, both terrestrial and marine. So I want to go deep into our pillars, which we have 3 pillars which are interconnected. So the first one is on nature-based solutions, where we have 3 of them, and my topic comes from one of the nature-based solutions under this, with the culture that is deep-rooted in one of the communities around the forest. And this is directly linked to the women agency and also on issues to do with governance. So under the nature-based solutions, we have trainings and input for women on seaweed, mangrove, and forestry conservation. And on the agency of women, we have the trainings on gender justice journey. This is a methodology that is being used for the women who are working around the forest. And we're also working very closely with the women rights organization and youth-led organization and the 4K clubs, that is in schools in Kenya. So let me now go deep into my topic, and I'm asking myself, why Kaya Chonyi? So when you look at my picture, you can see some huts, and it is inside the forest. So these are the sacred Mijikenda Kaya forest, which is recognized with UNESCO as World Heritage Site, located in Kilifi, and we also have some in Kwale. We have a variety of them, which looks like that. And in this forest, which are called Kayas, they have biodiversity, an exceptional one, very rich in biodiversity when it comes to rare species of birds and reptiles. And these forests once sheltered fortified Mijikenda villages in 16th century until about 1940s. But as we speak right now, in this sacred Mijikenda Kaya forest, we have very few villages where people go and conduct some rituals there. So why do we have a decline in this? One is because of the culture, which was once deeply rooted, but it has reduced. It has, with also the issues of population, it has caused a very significant fragmentation and leading to significant loss of the tree cover. And I want to speak more on the culture, which it is depressed when it comes to the communities around it. So what are the causes of this culture in the Kaya forest? So one of the reasons why we do not have that culture that once was used to preserve the forest is that we have stigmatization of traditional practices, where many traditional cultural practices were labeled as witchcraft. So many people distance, especially the young people, distance themselves from this. There is also fear and misunderstanding, where some genuine harmful practices are grouped, and as a result, there is fear. So people fear being part of that. And there is also influence of modern religion with the rise of Christianity and Islam. So there is little that people now cling on the indigenous and the culture that they have before. Then also there is loss of traditional knowledge, where the old people, when they die, there is no one to inherit the deep culture that they have from these communities. So what are some of the challenges that women face under this culture that we once had and which we still have it right now? So one is harmful cultural and traditional norms, where the women are not given that decision. They are not given the leadership, because most of this system, especially which were governed by customary systems, they are given to the male elders. Then another point is that on limited representation in leadership structures, and we have what we call community forest association, where we'll see that the roles are not given to the women, and if they are not, and if they are given, then they are not influential when it comes to decision making. Women also lack a secure land tenure or rights for forest resources, and we have also the issue of customary land ownership practices, which tend to favor men, reducing women take in forest conservation and discussions. So there is also low access to information and training, which is very important when it comes to women. And women often lack access to capacity building opportunities in forest conservation. There is also literacy gap and household responsibilities further limit their participation. We have the fourth point, which is the triple gender role, where women are confined to reproduction, communal role, and also they are the productive part of the family, where they are breadwinners. So you realize that they do not really participate because they have other things to do when it comes to environmental conservation. And we have gender stereotypes and bias, and these are societal attitudes often undervalue women's opinion and leadership potential. So what is the project doing? That is the COSME project. What is it doing to make sure that these women, because we are working with around 15 communities who are living around these culturally rooted forest. So under Kenya Wildlife Service, which is the key body that conserves the gazetted forest in Kenya, COSME project was given around 16.1 hectares to be able to rehabilitate with the women who are living around this deep ecosystem. And we are working very closely with the community to make sure that we build their capacity and even provide the inputs according to the 3 pillars that we have. So one of the activities that we are working very closely with the community is that we are rehabilitating the degraded areas, and so far we've planted more than 20,000 indigenous tree species just to bring back what it was before. And another activity is that we are doing trainings on gender responsive participatory forest management, where we have a manual for capacity building sessions on skills and knowledge for inclusive forest management to ensure that women and men actively participate in forest management decision making. Then we have also a methodology which is called the Gender Justice Journey, and this is a household methodology for influencing social norm change, and it focuses at advancing gender equality and economic empowerment to the women that we have around this forest. We also have a component where we are supporting the women to have agroforestry in their farms. And through agroforestry, we promote, there is promotion of sustainable agriculture by integrating fruit tree bearing trees into farming system, enhancing food security, income generation, and environmental resilience.
Hello, Caroline.
We have...
Hello?
Yes.
Sorry for interrupting
Yes.
you. Sorry for interrupting you, but you have 1 minute left, so kindly wrap up your presentation, please.
Yeah, thank you so much. I'm almost done. So under that, we are supporting the women to at least have something and to economically empower them. And this is linked to establishment of tree nurseries. You can see from the picture that I have, happy women having tree nurseries where we are able to purchase tree seedlings from them, and they plant in the gazetted forest. Then we have the formation of community forest association, which is very important to the community living around the forest, and beekeeping enterprises for them to be able to have nature to once they harvest the beehives, they are able to have something that they can be able to sell. Thank you so much.
Thank you so much, Caroline. We can clap hands for Caroline just to appreciate the comprehensive presentation that she just shared with us. Thank you so much. Without wasting any more time, we have another presenter online. Gabriel, are you there?
Yes, I'm here. Thank you so much for having me.
Thank you so much. Gabriel is a program director for Sounds Rights Museum for the UN. Thank you so much. You have the floor.
Thank you very much, and thank you for having me. Yes, as mentioned, I'm the director of an initiative called Sounds Right, which is a global music movement to recognize the value of nature and inspire millions of fans to take action. Given it's a music initiative and very visual, I thought the best way to kick this off is to share a 2-minute video explaining the initiative and our first year of launching Nature as an official artist.
Sorry, Gabriel, as you are sharing the video, you have 8 minutes. You have
Thanks.
8 minutes to deliver your presentation. Thank you.
Got it.
Imagine working 4.6 billion years for free. Neither could we. So we invented a first of its kind model for nature, now officially an artist.
Famous musicians are lining up to perform with a new up-and-coming artist known as Mother Nature. And this new idea that's coming in about using natural sounds and giving royalties to those animals that use it for conservation.
It's about time that artists and Mother Earth finally shook hands. Sounds Right is built as a fully functioning business model. We record sounds of nature from around the world, artists to use in their music.
Yes, that's it.
And credit nature as the artist she truly is. A model that helps nature keep growing, as tracks are continuously released in partnership with global artists. Allowing fans of music to become fans of nature by simply doing what they already love doing, listening to music.
We have put together a really high-level executive advisory panel to help then direct the funds that are collected through those royalties back into nature conservation.
We launched in partnership with Spotify, the global network of billboards, with the notion that nature is now an official artist and finally credited for her work.
You can listen to nature sounds and actually do good for the environment. Nature's a musician now.
Oh, nature, man. This is a great feature.
With over 3.7 billion media impressions and over 150 million streams from more than 14 million listeners, Nature became a top 1% artist worldwide.
The interesting thing about this project is that we're setting up a very long-term payment stream to organizations that are trying to protect the earth.
How does that sound? Cheerios. A breakfast.
We'll make you watch a video about Cheerios, but I hope you enjoyed and got a sense of what Sounds Right is all about. So why did we launch Sounds Right? Well, it's because the Earth's staggering biodiversity is in a state of crisis. Wildlife populations have declined an average of 69% the last 50 years. 1.2 million plant and animal species are estimated to be at a threat of extinction, and many more harrowing facts. And arguably, we've so far failed to address the root cause of the biodiversity crisis, and that is, in our view, that the economic model doesn't properly value nature, instead treating it as a resource to be optimally exploited or a place to dump our waste. So the question we ask at UN Live is, how might we prompt millions of people to reconsider how they and their society value nature? And the argument is that we should meet them where they are, and in this case it's via the phones in their pockets and the things that they already love doing, like listening to music. So on Earth Day last year, we launched Nature as an official artist. For the first time in 4.6 billion years, Nature could be credited for her sounds with funds flowing back to biodiversity conservation. Zooming out for a second, Sounds Right generates impact in 3 different ways. The first is, of course, generating an entirely new revenue stream for biodiversity conservation. So we project generating $5 million a year for conservation by 2028. 5 million is both a big and a small number. It's big given it's a massively underfunded space, and this money can have transformative impact at a local level. But small given the scale of the crisis. We know that to address the trend towards biodiversity decline, we need much, much more. But what we think is unequivocally a huge number is the number of people who will be taking action. 200 million people each year taking action by streaming music featuring nature, sounds of the natural world, and therefore directing royalties back to nature conservation. And our hope is this builds a sense of agency in our collective efforts to protect the planet. And last but not least, it's pushing the public discourse on how we value nature in our society. So 1,000 media pieces discussing nature rights and our duty to protect it, and championing new business models where nature is properly valued. So how are we doing? Nature's already a top streaming artist with over 200 million streams across 20 million listeners across 181 countries around the world, putting Nature as one of the top 0.2% artists on platforms like Spotify. We also know that nature's sound and exposure is growing. We've had over 60 featuring nature tracks where we've invited human artists to feature the sounds of nature in their music. This includes artists from around the world across different genres and different demographics too. And what you're looking at here is a billboard in Times Square last month where nature was championed as an artist. I mentioned pushing the public discourse. So far, the story's been picked up by over 560 media outlets around the world, including the BBC, Times of India, Forbes magazine, and many, many more, with a potential audience of 4.2 billion people. So this story is really capturing the imagination about how we might value and credit nature. We've also been pushing nature connectedness amongst young people in Denmark, Colombia, and soon in Kenya too. And we've supported almost 900 children to complete a basic acoustic ecology course in Bogota and several others in Denmark too. And we've found via a very small sample a statistically significant increase in nature connectedness. So we're excited to scale these models. Another big part of what we're trying to do is bring biodiversity into the mainstream. So we've presented Sounds Right at over 70 significant events, including COP16, COP29, and we'll be there at COP32. Nature has also performed at festivals like Glastonbury and Roskilde in Denmark. And then Sounds Right has also won a number of awards. So actually last month we won a Cannes Lion Grand Prix for innovation, beating Apple and Nestle and many other commercial brands with this initiative. So we're very excited by the audience we're now engaging. So just double clicking on the money for a moment. So far via the Sounds Right Fund, which is hosted by a UK registered charity, Earth%, we've donated just under $250,000 to community and indigenous-led conservation projects in the tropical Andes. And later this year, we'll be committing over $400,000 to similar projects in the Amazon and Congo Basin, some of the lungs of the Earth. And in turn, that's supported 4,500 hectares of natural habitat, and 6,000 people directly or indirectly have benefited. So essentially, we generate royalties from streaming. Yes, one more minute.
Sorry for interrupting you. You have 1 minute to wrap up. Thank you.
Okay. So yeah, 50% plus of the recording royalties go to high impact conservation projects in key biodiversity areas around the world. We have an independent executive advisory panel that takes decisions on where those funds go. That panel is majority Global South. It includes representatives of indigenous peoples, given the outsized impact that those communities have on protecting the world's remaining nature. Here are 4 of the projects we supported in the Colombian tropical Andes. As I mentioned, each of them are indigenous or community-led. And last but not least, we're gearing up for COP30, where we'll be announcing funds going to the Amazon and Congo Basin, but we'll also be releasing music featuring sounds of those places too, and also democratizing the opportunity for any artist to collaborate with nature. So all you have to do is listen wherever you stream your music, on Spotify or Apple Music or Amazon Music, wherever you might be, search for nature in capital letters and enjoy our music and in turn donate to biodiversity conservation. Thank you very much.
Thank you so much, Gabriel. Quite interesting delivery right there. Please stay online. I'm sure most of us have questions on what you have just delivered. Thank you so much. Thank you so much. Without wasting any more time, we are now going to get into the next session of our session right now. We have our panelists. The first panelist that we have is Samantha, who will be joining us online. Samantha, ecosystem restoration specialist at UN Decade Ecosystem Restoration. Are you there, Samantha?
Yes, hello, I'm here.
Oh, thank you so much and welcome. And we are now having, we also have Jane. Jane is a policy and advocacy officer, Center for Study of Adolescents in Kenya. Thank you so much for joining us. Our next panelist, we are going to be having Sinea. Am I pronouncing the Sinea? Thank you so much, Sinea. Thank you, thank you. A special sectoral envoy on indigenous people at COP30 in Brazil. We also have our last but not least panelist, Putira. Putira, are you here? Putira is a director of the Department of Primary Indigenous Healthcare at the Indigenous Health Secretariat of the Brazilian Ministry of Health. Can we give a round of applause to our panelists as they join us on stage? Thank you. Thank you so much. I am going to start with Samantha. Samantha, can you help us understand the concept of ecosystem-based adaptation and how the UN Decade is using this to strengthen the resilience of women and girls? And a follow-up on that is, how does it contribute to your scope of nature-based solutions work, ensuring their rights, knowledge, and participation are at the forefront of the initiatives?
Yes, thank you so much for having me. It's a pleasure to be with you today. So yeah, as you mentioned, I'm here on behalf of the UN Decade on Ecosystem Restoration, which is an initiative led by UNEP and FAO, and I will answer your question trying to indicate how we are really embedding indigenous people's rights, including women and girls' rights, into all the work that we are doing. So the goal of the UN Decade on Ecosystem Restoration is to prevent, halt, and restore ecosystems worldwide. And of course, ecosystem-based adaptation and nature-based solutions are one of the main approaches of this initiative and this program. So we as the UN Decade acknowledge the importance of indigenous peoples to achieve our goals, and we acknowledge the importance to involve them at the whole process, not only as beneficiaries, but as right holders and decision makers. And we know they are key partners for restoration and nature-based solutions. So, as I was saying, we are trying to bring indigenous people and women and girls' rights into all the work that we are doing. So it's more like a cross-cutting aspect and topic that we are having in all the work of the UN Decade. And it goes from strategy to coordination to monitoring and to implementation. So I'm gonna give you some examples of how we are working to ensure that indigenous people is taken into consideration. For example, we have launched the Standards of Practice to Guide Ecosystem Restoration in 2024, and this was as the name says, it's a guide on how we can or how implementers on the ground can success when they implement ecosystem restoration. And what we did in this publication was to develop this guide with indigenous people. So there was a drafting committee of indigenous experts from the Global Hub on Indigenous Peoples' Food Systems that directly informed the content of this publication. So with their contributions, we ensured that the standards integrate not only rights and safeguards, but also the cosmovisions and ancestral food systems as core elements of the guides. Of course, taking into consideration also the aspect of women and gender roles in this guide. We also have, at the UN Decade, we have a capacity, knowledge, and learning action plan, which has different initiatives that were identified as knowledge gaps that we need to work on to advance ecosystem restoration. And one of these initiatives is focusing on indigenous people restoration approaches. So this initiative will be co-led by indigenous people from the design to the implementation. And the objective is that indigenous communities can document by themselves and share the restoration practices with their own voices. So the idea is to ensure that there could be knowledge exchange between indigenous communities and that they are the ones telling the story. We are also working in this initiative to try to bring the women aspect and the gender aspect to ensure that they are also represented in these approaches. We are also working with a challenge, we call it challenge of an action plan, which are kind of like the leading activities that are guiding the decade. And these ones are like as I was saying, the activities that guide us from commitments to action. So one of these challenges, it's focusing again on indigenous people, and this one is focusing on recognizing the land and resource rights of indigenous people and local communities as cornerstones of global restoration movement. So what we are trying to do here, working with partners, NGOs, indigenous communities, and even academy, is to try to promote the leadership of indigenous people, again, bringing the gender aspect so that women leaders can be involved in this challenge, so that we can bring this to the environment agenda. We are trying to promote locally led restoration practices and include them into national, regional, and international restoration planning. So, for example, we have worked with indigenous communities so that they can showcase the work that they are doing and why it's so important to have them as key stakeholders. We have worked and we have organized some events at COP, CBD, and UNCCD so that we can showcase indigenous restoration models, knowledge systems, and the importance of upscaling indigenous-led and community-driven restoration. So as you can see, it's also trying to bring indigenous people and the gender focus again into the policy development so that member states can integrate these aspects into their national plans.
Thank you, Samantha. Thank you, Samantha. In the remaining minute, can you take us through how we can scale ecosystem-based adaptation solutions in the next 5 to 10 years, and what we must avoid in implementing this concept? How can it be most transformative, especially for women and girls, in the remaining 1 minute?
Okay, so thank you for that. So I think what we need to do is to really involve women in the planning of the ecosystem-based adaptation solutions. So we really need to involve them since the design of the project so that we can have their vision and so that we can adapt the projects in a sense that they can benefit and that they can really be empowered. And what we also need to do is like to support and promote and advocate indigenous people and women-led projects so that they can receive more support from governments and from private sector, for example, because this is one of the main gaps that they are seeing, a lack in funding. So we need to try to advocate and promote this type of projects globally and in the international agenda so that they can receive more support. And again, it's really important to involve women since the design and planning of the projects.
Thank you so much,
Thank you so
Samantha.
much.
Thank you so much. In the interest of time, I'm going to go straight to Jane. Jane, can you discuss in what ways can nature-based climate solutions be designed to help to advance sexual reproductive health for indigenous adolescents and young people? You have 6 minutes.
Thank you very much, and I'd like to take this opportunity to thank UNFPA through the SRHR and Climate Justice Coalition for this opportunity. So for me, when I look at nature-based solutions and sexual reproductive health and rights amongst adolescents, indigenous adolescents and young people, 4 key issues come to mind. One, as we even look at designing these solutions in a way that they can advance SRHR, is there awareness on what nature-based solutions are and how this interlinks to sexual reproductive health and rights. Similar to Caroline, we also work at the coast in Kenya, where we work with beach management units and community forest associations. And for us, our initial entry point was to ensure that there's awareness. We educate the communities on how these 2 key issues interlink. Because even for sustainability, these vulnerable communities, the young people need to know what are nature-based solutions, how does these solutions manifest in their lives, and how does this link up with sexual reproductive health and rights in their context. And my second key issue is also looking at collaboration across sectors. When you look at nature-based solutions, immediately the environment sector comes to mind. When you look at SRHR, you have the health sector. Of course, gender issues are also cross-cutting and cannot be ignored. So there's really need to collaborate across sectors. Even as we design these solutions, do we have the key actors on board to ensure that these solutions address the needs of the indigenous adolescents and young people, and that these key issues are derived from some of the needs from these communities. For us, we also undertook a community assessment where we brought the communities on board and asked them what are some of the key issues they are facing environmentally and socially. And from that, we were able to identify which are these key sectors that we need to bring on board, even as we design these solutions. If you look at mangrove restoration at the coast, the communities have also taken up sustainable practices such as butterfly farming, beekeeping, protecting marine ecosystems. So it's all about identifying the key sectors that need to be part and parcel of this. And this also involves capacity building these actors for them to also be part of building these sustainable solutions, nature-based solutions that can help advance sexual reproductive health and rights. And thirdly, I'm looking at involvement, meaningful involvement of young people in the designing of these solutions. Most times we leave out the adolescents and young people out of such engagements, but for me, I'm looking at how can these young people be part of the solution, considering these indigenous communities, they have their ways of doing things, and how can we bring together the indigenous knowledge and scientific knowledge that we have to ensure that these communities their needs are acknowledged, their views are also appreciated and brought on board when designing these solutions. And when you even look at sexual reproductive health and rights amongst these communities, they have their own way of doing things, even when it comes to accessing services. And for us, the first point was to get to understand when it comes to accessing maternal health services, contraception services, what were their key concerns, and how do we bridge this gap? And also this involved bringing the healthcare providers on board, for them to also understand the context of these communities, the sexual reproductive health rights and needs of adolescents and young people, as we come up with solutions that look at the interlinkage of nature-based solutions and sexual reproductive health and rights. And most importantly, we have policy. As much as we may design nature-based solutions that are also aimed at advancing sexual reproductive health and rights by promoting the interlinkage, the integration while addressing these issues. It's very important for this to also be embedded in policies and plans at the county, which is subnational level for us in Kenya, and at the national level. Recently, Kenya has come up with a National Gender and Climate Change Action Plan, which looks at climate change in the context relating it with gender issues and health issues as well. So when we have such plans, when you have policies in place that addresses these issues, then it's even easy to advocate for resource allocation for us to be able to implement some of these solutions that indigenous adolescents and young people have come up with within their communities. So very important to have this policy, to have this in policies and to have this in plans for implementation. And also just to add that acknowledging the young people when coming up with these solutions is very important. Their contribution, their efforts, and them being part of co-creating these solutions that can also help advance their sexual reproductive health and rights, and leveraging on indigenous knowledge as we do all this, as we try to advance sexual reproductive health and rights from a perspective of nature-based solutions. So maybe if I can just give a context-specific example of Kenya. For the project we're implementing in Kilifi County, which is on sexual reproductive health and rights and climate change, initially when we started interacting with the groups, we realized that working with both beach management units and community forest associations, of course there are various needs or there are various challenges that they face, especially when it comes to now the natural resources that they used to depend on no longer providing for them the way they were used to. So for us was, of course, creating awareness that things are changing. You also need to change your mindset, but not forgetting that for us, we were also cognizant of the fact that they're used to doing things a certain way. When it comes to the mangrove restoration, planting the mangrove trees at a particular point in time. And one area that was really lagging behind, of course, was on accessing sexual reproductive health. And for us, bridging that gap by bringing in our healthcare providers, taking community outreaches to them to cultivate that health-seeking behavior, that as they continue to conserve their environment, coming up with very good nature-based solutions, but they also prioritize their health and continue seeking health services. And for the money that they make from some of these nature-based innovations and solutions, they also prioritize using some of that to ensure that they're able to access health services within their communities. Thank you.
Thank you so much, Jane. We can clap hands for Jane. Thank you so much for highlighting how best we can use nature-based climate solutions to address SRHR, especially in the face of climate change. And at this point, I'm going to move to Sinea. Sinea, as the special sectoral envoy on indigenous peoples for COP30, how do you envision strengthening indigenous peoples' participation in the global climate decision-making processes and project implementation that addresses community and individual resilience and nature-based solutions? You have.
Thank you. Good afternoon, everyone. It's important to bring this question to the floor. Indigenous peoples have a path that they have achieved within this space, especially concerning UNFCCC. So ever since 2008, we have within this convention Indigenous People, which is the biggest climate change forum for Indigenous peoples, where we are there globally taking all of our demands on the themes that are being discussed within UNFCCC. It's important to say that this is one of our achievements, so we can be in such spaces taking our voices, especially in decision-making spaces. And it's important to say that in this year, where COP30 will be in Brazil, where we are going to gather an expressive number of indigenous peoples that perhaps did not even exist in other COPs, what we want to do is to bring this work that indigenous peoples have been doing and strategies to be in decision-making spaces, taking our voices further, as it is important for us to bring to the academic researches and what is discussed on documents within such spaces, that indigenous peoples have their own references, knowledge, and their documents that are articulated and well built as a strategy to inside within these spaces. It's important to say our pathway ever since ECHO 92 that we are part of the solution, and we have been doing this work within our communities with all this indigenous scientific knowledge, so we can truly take to such spaces where we have one sole objective to look at solutions. When we are talking about nature-based solutions, we are already suffering the direct impact, especially on medicinal plants. This was one of the solutions that we had as our live pharmacy, and now we face this problem. So how can we also have a rapid response through climate financing so we can keep this work that indigenous peoples have been performing within their indigenous lands? It's important for us to bring this to reflection. Indigenous peoples have been storing this knowledge. I won't say even it's a millennial knowledge. They have been doing the maintenance of ecosystems with, they have been preserving biodiversity with their knowledge, the scientific indigenous knowledge. So it is important for us to bring right now this regard that we are discussing here. How can we at each day help so that the nature-based solutions can reflect truly what we are discussing, and especially when we talk about climate change? It is truly important to tell you that what indigenous people have been producing as documents that we call documents that will interact in such spaces and be used as a mechanism for indigenous peoples. I have been working, I don't know if they have placed it on the screen, but I have been working on indigenous adaptation plans. These plans bring how women, for example, have been in communities, they wake up, they go to the river. So their routine has been showing especially how climate change has directly impacted their social, cultural, and healthy life. That many times we don't see that in researches, in health or any other place, if we are not there living and seeing how women have been impacted, how girls have been impacted. When we, for example, have in the Northeast right now in these high waves, the fact that PMS comes earlier, we don't see this written anywhere, but we have such data from these indigenous adaptation plans that we have been building in the Amazon, and we have also been taking this to indigenous peoples platform within UNFCCC, where we have presented this in official meetings to show that indigenous peoples create their plans, and we place an ethnico-ecological calendar for which they have a time to harvest, to plant. They have women's routines and the plants that are disappearing before we even can acknowledge them. And we also place stronger and weaker seeds during winter and summer. So we have organized ourselves to create our mechanisms to be in spaces discussing especially and taking our voices. So it is important for events such as this to emphasize that we need to recognize the knowledge of indigenous peoples, and with the academia, with researchers, and even IPC, we should bring this as part of the solution to truly be able to guide what we want as to face climate change. Thank you so much.
Thank you so much, Sinea. But in just 1 minute, how can COP30 be transformative for indigenous communities, especially women and girls, in regard to climate adaptation and resilience building?
Yeah. In regards to climate adaptation, we must be included in the decision-making spaces, because in these decision-making spaces we must take our voices and have a document where it's going to become a public policy and go back to our territories. Thank you very much.
Going to move to Putira. Putira, what concrete steps does the department take to overcome institutional racism or structural barriers within the national health system that disproportionately affect indigenous peoples, especially under climate stress? You have 6 minutes.
Boa tarde.
Good afternoon. It's quite a complex subject. I'm going to say to not even show the slides, because what are we as far as Indigenous Secretariat doing? We're working together with the territories. We can only get an adequate policy if we work with the people. And with this, we are updating our national policy that hadn't been updated for over 20 years. And we've just finished in this June the last regional seminary, where we brought the indigenous peoples of all regions to participate in a dialogue with the 6 axes of our policies. Within this, I'm going to put indigenous medicine. That brings the recognition of all the healthcare technologies that we have within the territory. Like this, we bring indigenous women to the space, while as the biggest fosterers of science in the territory. So when we're talking about climate change context, we are talking about the context as well from the invasion and deforestation, and this entire issue is reflected onto indigenous women and girls. So that means we're talking about healthcare technologies from the territories, from the midwives, and so on. We're talking about specialists within the territory. And with this, we want to launch the first indigenous medicine program as original peoples of Brazil. So we want to have a brand new policy that's going to be launched at the end of the year, so that this program can be recognized, recognizing all the technologies. And who said we're not scientists in our own territories? And with the process of the climate changes, we start noticing the change as well within the territory with the medicinal plants, but especially with the transmission of science with girls, and so imparting this knowledge from our more elderly to the girls. We have also reports that showed that the medicinal plants and the care with indigenous women is also threatened with the births. So we have, for example, we have fish that we use for women to feed themselves during pregnancy. And these fish, for example, we cannot find anymore nowadays. So this is a whole question of inequality, social question, is reflected in the health of people. So in our secretariat nowadays, we take on the whole inequality context within the territory, because the consequence of that is on what we call health. And health for us goes beyond the territory demarcation. That is to say, territory demarcation is a historical fight that we've been having, but it goes far beyond that. That is to say, we need to have this considered as a original science that is at risk because of the climate change. We are going to be present at COP30, also launching the first national program for sanitation. Thank God that it's with us, indigenous people in management, now occupying these spaces, because all of us came from our territories. We know how complex it is. We also know that we must build with our sisters and brothers in the territory. This is fundamental so we can advance in the indigenous health policies so that they actually take place with indigenous people. Climate change, as well as we know, don't impact everyone equally. indigenous populations, especially us women and girls, are at the front lines of the environmental and social and economic effects. With all these transformations that have been taking place in many territories, these are the people that ensure the food security of their communities, especially through the intercultural context with their science and especially with their courage. The challenges that these climate changes are imposing on us is very cruel. As a Brazilian state, we have the institutional duty of listening, recognizing, and integrating the indigenous people and their processes, among them listening to them in COP30, participate, and have a decision-making voice. It is no longer possible to think about public policies without the active presence of indigenous women. We should not look at them just as beneficiaries anymore, but especially as builders and strong leaders within the entire decision-making process. As far as the health point of view, especially at ministerial level, I say that it's fundamental to recognize the effects of the climate crisis manifest themselves also in the body and our territory. After all, our territory is our body, and our body is our territory. The increase of water-borne diseases, forced relocation, and the psychosocial suffering are concrete examples that demand integrated answers with intersectorial approaches, territorialized, and especially that cultures be respected by all institutions at a national and international level. Kakurete, thank you.
Thank you so much, Butira. In the interest of time, I'm going to take some questions. And please note that Gabriel is no longer online. So if any of you has a question for Gabriel, we can do that online, I am told. So I'm just going to take a first round of questions. If any of you have any question, please also, as you ask your question, indicate as to who your question is directed to in the interest of time. Yes. I see you.
Eu vejo uma mão. Tem outra lá. Obrigado. Thank you for the presentation. I followed all the presentations with lots of care. I would like to talk about the colleague in South Africa, or the program in South Africa. We saw realities that are obviously not pleasing to anyone, but I would like to say that we shouldn't be afraid of proposing solutions with the populations. We just have to see them as partners that are beneficiaries, and that we see them also as people that would like to take care of their territory, discuss the solutions that we want to propose, and to get their adhesion, their buy-in before we do it. And just to talk about the fear of the colleague that said we cannot take the risk of planting the trees, because I just want to say that there are solutions that are adapted to nature. When I take the example of the creation of ecological carbon, charcoal, instead of cutting down the trees to warm themselves, teach them how to create this ecological coal And that would allow them to have more trees that'll keep it cooler, and also to stop them from having a droughts increasing. And that will contribute them in protecting trees as well, but also to have this solution of capacity building and creation of this ecological charcoal that would also allow them to have an income.
This one is directed to Strobner. So kindly, you have 30 seconds to ask your question. Let us just be short and precise and straight to the point. Thank you for that. There is another hand over there. I think there was also another hand. You can continue. Then she will come after you.
Olá, meu nome é Eduardo.
Hello, my name is Eduardo. I'm a journalist, a visual journalist, a documentarist. I'm developing a thesis for the next documentary, which is about adaptation that Quilombolas population had to do to manage to survive in times of extreme vulnerability. So the idea is to observe initially what people that were enslaved that left the farms and managed to maintain themselves in extremely hostile territories and isolated territories, and how they managed to keep themselves alive during this period. Some of the axes of my research, there are three axes, main axes, that show how they managed to survive, that are learning, the capacity to learn with indigenous people, so to have food sovereignty, construction of a solidarity in terms of that from solidarity to manage to maintain themselves even more present. So within this vision of how the Maroon people or Quilombolas, with the technologies that develop at that moment, so we can apply it at this moment. The question is, how can we implement the technologies of traditional peoples in development of public policy for climate adaptation of urban people, still having whiteness as the main, or white people as the main implementers of these policies? This question is in the sense that I feel that we might have a lot of solutions, but solidarity as a solution is very powerful, perhaps one of the most important ones, and that was transmitted by the knowledge and this position of women in the Quilombos. But this is a particularity of these people, that is not of the people that live in cities.
For your question, I want to believe that my panelists here have caught your point. Thank you so much. We will now move to, in the interest of time, thank you so much for your question. We appreciate it. In the interest of time, we will move to, you can ask your question, please.
Okay.
You have 30 seconds.
Ok. Meu nome é Dandara, sou brasileira.
My name is Dandara, I'm Brazilian, here from Brasilia. I'm really happy with this panel with lots of women, indigenous women especially. We've felt there was a lack of black, indigenous people here in this event. So I feel like this voice was slightly silent, so it's nice to finally have you here, even if it's at the end of the event. What I'd like to ask is, when we look at the African continent, we look towards them with hope, the hope that we can say, oh, our motherland, us as black people, right? We look at Africa and think, we look, and from there we have hope. And when we look at indigenous people, we also have this look of hope. Is with this world vision, cosmovision, that is going to bring us the hope for true transformation and change. So I ask you, what do you see in these events? Do you see that your voice is going to be heard, or is it just yet another space of a fight, or is there actually hope?
Pressured for time. I am sorry, I'm gonna have to cut you off. We are really pressured for time. I don't know if we have any other question. I'll take the last hand. The last hand in the interest of time. Yes, ma'am. Please keep it within 30 seconds. Please.
Good afternoon. My name is Stephanie. I'm a woman from the north of Brazil, and I bring here the voice of students, especially medicine students. I want to talk to you a little bit about the studies and the medicine association. We have the scientific knowledge, but we also need to value the traditional indigenous people's medicine knowledge with the use of these substances that we don't usually have within the traditional medicine that's based in a knowledge that does not follow these others. So my question is, how can we associate traditional medicine to and with through these impacts that it causes in women's lives, and how can we bring this to the academia in a way that it can actually be in the curriculum, so that it's not optional but truly a basis for curriculums?
All for your questions. I'm going to ask our panelists here to assist in terms of answering the questions. I will start with you, Shobna.
Thank you so much. Yeah, sorry, I did run out of time while speaking about our co-design process and what we're actually going to be doing. So thank you very much for bringing that up. When we went into our co-design process with pregnant and postpartum women, they were very much a part of the discussion. We gave them information from the study, they gave us their perspectives from the community, and even though they said, you know, just be careful about planting trees, one of the solutions that we are putting in place is planting trees. It's just that we need to be wary of where we plant the trees. We need to ensure that they will get sufficient water. We are putting in place some water storage tanks so that they have access to water. And around those tanks, we're planting trees. We're also planting trees around soccer fields where the youth gather. So we definitely are putting in place some nature-based solutions. And we're also putting in place a climate hub. So that is sort of a cooling space that pregnant women and adolescents can go to. They'll get additional information. We'll do lots of capacity building in that space. So what you said makes absolute sense. We completely agree with you, and we are moving in that direction. Thank you.
Thank you so much. Samantha, are you still online? Hello, Samantha? Hello?
Yes, sorry. I'm still here.
Oh, thank you so much for being online still. Can you try and answer one of those questions that were raised? Did you catch any of those? Would you want to try some of the questions? To answer some of the questions?
Sure. Well, like most of them were kind of like trying to talk about. Maybe I can try to talk about the one regarding if at the COP there will be like a good space for indigenous people. What I can say from the UN perspective for UNEP is that indeed what we are trying to do in these negotiations or in these spaces is to bring the perspective of indigenous people and try to bring them to the international agenda so that indeed the member states can take them into consideration. And so the work that we are doing as UN Decade, for example, is exactly to advocate so that these projects or these initiatives or the concerns from indigenous peoples and the indigenous people challenge are brought into these high-level events so that really there could be an exchange and a discussion between like the policymakers and the indigenous people so that there could be different solutions, or like inclusively we are working, for example, with indigenous people major groups, and the intention is that working together with them we can bring to these spaces their challenge, their concerns, and their proposals so that member states can really take them into consideration. And what we do at UNEP is really try to push for this. So this is like these COPs, for example, are really good opportunities to interact and try to bring the indigenous people agendas into the international agendas again. So we are doing our best, and from our side we are supporting in every possible aspect so that they can be represented and heard, and not only discussing but really bringing into implementation and to policy development. Thank you.
Thank you so much, Samantha, for that. I would like to come back to the panelists here. Oh, okay, thank you. You may proceed. Thank you.
I will answer for the Stephanie's part. I believe it is important to have you here, as it is something that ever since I entered my undergrad, I did master's, my doctorate, my PhD, and now I still lack the qualification of professionals for the intercultural context. And for us, this is fundamental, especially for services, be it for extractivists, riparian communities, indigenous people, or quilombolas. We noticed that university was not prepared to receive the diversity in Brazil. And I noticed that it's not only in Brazil, as I had exchanges. I noticed how not ready we are to be in such places. That is, if they're not ready, but we ourselves are not ready. Why am I talking about this? I'm talking about institutional and structural racism that we live on a daily basis for being indigenous peoples. Women, I can even say that the context that we have is even more serious, that we can add up to black women, quilombola women that go through the same situation. And with that, since I come from this place, we began a dialogue with MAC, the Ministry of Education. So indigenous help is not an option. We want for everyone, every university, to put this as traditional people. When we want to leave this place, we're talking about indigenous peoples, and that's why we no longer talk about traditional medicine. It's indigenous medicine. We each have our technologies for care, and this word medicine, we are taking it back. It's not something from the West, it's ours. We have more than 12,000 years that were scientifically proven by archaeology that we produce care technologies for more than 12,000 years. That is, I mean, your technology, how long does it have? So we are once more putting ourselves on the map on what it means to have these technologies of care and health. And with that, we are provoking the Ministry of Education, the medical residencies, that we want indigenous people there, we want scholarships, as this is our right. It's not because we are entering through quota and affirmative actions that we have no capabilities. That's not it. This is a historic reparation. It is to say that we should be there, that it's necessary to be there, and this intercultural context is important. We begin this dialogue and we are advancing because we have now indigenous health in multi-professional residency, but we no longer want to be an option. We have a policy, and we have a secretariat.
Much, Putira. In the interest of time, thank you, and I guess that answers the question around issues of solidarity and traditional medicine. Thank you so much. And I understand that we have a question online. Can we...
Hello, everyone. Hello, everyone.
Yes, we can hear you.
Yes, I'm greeting you from Nigeria. I'm Lizzie Wiener from Nigerian Women Agro Allied Farmers Association.
Sorry, you have 30 seconds to ask your question.
My question is this, because I spoke yesterday and said that the women farmers should be engaged in research. Like I heard somebody now say that planting of trees and making water available. I don't think it goes like that because if you want to plant a tree, you will do it first or second month of rainfall, and it rainfalls for 5-6 months in some areas. So within 4 months, the trees have gotten roots and have been stable, that they would defy the hot weather. I think it's cheaper that we do it in a way that we spend less money in the maintenance of water when we are planting trees. So the earlier you plant it, is the better. So my question is engagement of the farmers, the practical farmers in research, so that we can bring in our practical experiences over the years. I've been practicing for the last 20 years and I'm a professional. So I'm suggesting that we look into it. Thank you.
Thank you so much. It feels like more of a comment than a question. I don't know if I'm hearing you correctly. In the interest of time, I'm going to give Sinea 1 minute to respond.
A minute is a little, but I will try. Well, I believe that we bring here important subjects, especially when we talk about the legitimacy of indigenous peoples in scientific spaces. And I bring here an innovation that I have just defended my master's dissertation at UNB. As such spaces, despite not having been made for us, we need to use them, and we need to take our voices to such spaces to transform them and know how we can work with indigenous peoples. More than that, we need to bring indigenous professionals that are in the areas, and also indigenous researchers. They are legitimate, they are doctors in their own areas, to the academic researchers, and legitimize the knowledge that they have, not only because we go there and research, but we need to bring all this knowledge that is done within the territory and within science, say how we can make them sign their own researches. As many times they are just researched on, but they not have their names on the research. It's really important for us to value truly all the traditional knowledge of indigenous peoples that now we are truly taking, not because this will hinder anything, but these are indigenous scientific knowledges that we are bringing here as an evidence. Thank you so much.
I'm going to give each one of you just 30 seconds to just say the last comment in terms of what you would want the audience to remember going home. One takeaway. I will start with you, please. 30 seconds.
Thank you very much. For me, a takeaway is one, acknowledging the needs of indigenous communities, especially for adolescents and young people, their sexual reproductive health right needs. Two is co-creating to find solutions. Clearly, from all the questions and the comments that have come up, there's really need to prioritize co-creation to ensure that we're able to leverage on each other's expertise from the indigenous communities and scientific. And last but not least, even as we look at advancing SRHR through nature-based solutions, to acknowledge that SRHR is an adaptation and resilience strategy as we do that. Thank you.
Thank you. Samantha, you have 30 seconds. Are you still there?
Yes, thank you. Similarly, I would like to say my takeaway would be like to acknowledge the importance of indigenous people and to ensure that to acknowledge the importance to ensure indigenous people rights and land rights, so that ecosystem restoration and conservation can be successful, and similarly to promote the integration of indigenous people into the creation and implementation and development of nature-based solutions. That would be my takeaway.
Thank you so much. Sinea, back to you. 30 seconds, please.
To not forget indigenous peoples, remember that to handle all these subjects, ecosystem, biodiversity, we need to have demarcated lands. And to be in your memory, the answer is us together for the theme that we have been handling. Thank you.
Ira, over to you.
May care health technologies be recognized as public health.
Shobna, please.
Thank you. I think just to echo the sentiment around co-creation and involving our communities in the solutions that we build so that our uptake is higher, the adaptability is built in, and that we have good acceptance of some of our solutions. Thank you.
Thank you so much. And as we wrap up our session, as we conclude this session, several critical insights have emerged. One, climate change deepens historical injustices. Indigenous communities face compounded vulnerabilities due to colonial legalism, land dispossession, and systematic exclusion. Climate change intensifies these injustices, affecting livelihoods, health, and well-being, especially for women and girls. Disruption of SRHR services, that's the second one. Climate-induced disasters severely hinder access to sexual reproductive health rights. Women and girls in indigenous communities often experience reduced access to contraception, maternal care, and protection from GBV during and after a climate crisis. And thirdly, the power of holistic rights-based solutions. Nature-based solutions must go beyond environmental goals. Integrating SRHR, GBV prevention, and harmful practice mitigation within climate adaptation strategies is essential to support indigenous women and girls meaningfully and sustainably. And the role of traditional knowledge and leadership also came out very much clearly, that indigenous people possess generations of ecological knowledge, offering valuable insights for climate resilience, early warning system, and sustainable resource management. Their leadership is not optional, but it is indispensable. And last but not least, the issue of equality in climate policy. True climate justice requires dismantling barriers to indigenous participation in global and national climate decision-making. And this includes upholding principles like free, prior, and informed consent, and ensuring culturally appropriate, inclusive policies. Thank you so much for your time.
Very well. Thank you so much. We thank all the members of the panel. Please position for an official picture, please. Very well. Thank you so much, Mam Hila, and everyone for this clarifying discussion on nature-based solutions and indigenous peoples. I would like to inform that we are going to alter the program, and we are not going to go for the coffee break right now. Madam Alicia Cafaro, our rapporteur, will present the instructions for the work that we're going to perform now. Well, guys, good afternoon. We are finally at the moment that we are going to review the document that we were able to write with many hands, trying to integrate as best as possible all discussions, comments, suggestions that came up both on panels, sessions, as well as the audience comments. This was a productive work, an exhaustive work. We have tried to balance the understanding of being able to place all themes and ideas that were talked about, but as well to be concise in trying to call to action. So We have the same Padlet and online board. We have sent it to you through your email. Those who are in Zoom, there will be a link on the chat. We also have QR codes here to facilitate for those who need. Those who think it's hard to read in your computer, we also have some printed versions in English and Portuguese. We have not translated to Spanish and French as we did not have time. We were only able to make a final version 5 minutes ago. I'm not gonna lie to you. And the idea is for this review to focus specifically on consensus. So it will inform if we agree with the recommendations and if we what is usually called red flags. We do not accept, we do not agree at all, as it's missing something really important or it's not written in an adequate manner. So we won't look at language, other details, or else we won't be able to finish up. I would like to set things up with you guys. The idea is also for the review to be done in a group so you can exchange ideas, but for those who want to do individually, you can do that. For those who are in person, we believe it's more interesting for the groups to be self-organized so you can stick with those who are close to you or those who have a more affinity to the theme that you work with. For those who are online, we have created groups per language to facilitate as we can't have interpretation within the groups. So we can handle all the people there. So I would like to know if you have any questions. The idea is that for those who are here, we should begin discussions, and when we finish up, we can go and come back when we have the coffee. We have an hour and 45 minutes for this work. I believe that we can set in working in 1 hour, or if you believe no, 40 minutes, everyone was able to finish up. Then we can ask for the guys online to give their okay, and then we speed things up, and then we have this 45 minutes to review the board here if we have any red flags and to make this discussion. I would like to reinforce an important subject that whenever you place any disagreement in which you cannot give up on, please make a justification and propose something else, how to solve this so we can handle later on to make any necessary adjustments, okay? I just would like to know if you have any questions. And online too, guys, if you are online, please, can someone tell me? And in person, just raise your hand. So I think I explained it really well. Is everything okay? And online? No? Well, then we can begin with our work. Those who want a QR code, come here. And those who want any support to have it printed here, we also have it. At Padlet, you're going to see that we have the actions divided into thematic blocks for each one. We have a box for each recommendation, for each action, and those who agree and there are no red flags, click on the OK button, and for those who disagree, place a comment and say red flag due to this and that. This is what I'm proposing. And that's it, guys. If you have any questions, tell me. And also in the first column, we have the PDF of the text, the full text. So, good work. Organize yourselves in groups or individually. Guys, the translation in Portuguese may not be perfect, but it will be reviewed. We have done it now in the final seconds when we have just finished it up. Just to tell you guys.
E aviso que eu me
And something I forgot, but for those who are online, as we're going to work with those who are participating in real time.
And the transmission YouTube, because we cannot do the transcription of all the working groups. So the YouTube transmission is going to come back tomorrow for the last day of the symposium. Thank you.